got two more walking in.
Good afternoon, Senate Finance.
Good afternoon, Mr. Chair.
Today is Wednesday, February 25th, and today we will start with Senate Bill 786, Transportation of Persons with Disabilities. And is the order still the same here, Tammy, for all of them? We're going to try to stay in this order, but we may go out depending on where folks are. But we're going to start with Senate Bill 786, followed by Senate Bill 570, followed by Senate Bill 865, SB 739, SB 890, SB 623, XB 626, SB 606, then 179, 637, 703, 866, 740, and 838. Mr. Chair, you have as much time as you need. The rest of your panel will take 2 minutes. Thank you.
Hopefully, I'll only take 2. So, thank you, Mr. Vice Chair. Mobility is important to all of us. It's life. It's moving around, getting things done, being part of society. And it is my belief, very firmly, that everyone deserves the ease of that to the greatest degree that we can help provide for. And that's what this bill is about. So we have a paratransit system in the state. We're talking about particularly this side of the state. Yeah, this side of the state. In the Baltimore region, MTA. And what this bill simply does is let groups like Uber and Lyft participate in the process of moving people with disabilities around through contract with MTA and RTA. It's pretty straightforward and simple. The key is to get as much availability to be able to do that. And that's what this bill does. And so I guess the thing that is most interesting about this, it's already happening in our state. WMATA already approved this on that side of the state. And so this is just the opportunity to conform what's going over there and has been going on since, I think, 2018. We're on to this side. And that's it. And I'll let my panel tell the rest.
All right. Thank you, Mr. Vice Chair and members of the committee. Rob Gargiello with Compass Advocacy. On behalf of Uber, I want to thank Chair Gazzone for sponsoring this legislation. I think very eloquent in explaining it. As was mentioned, what we're looking to do with this legislation is being done in the WMATA part of the state, so the DC suburbs. It's also being done in other areas throughout the country. There is a problem. There is a lack of transportation for persons with disabilities. This will get more options out there for those individuals. And beyond that, I'll kind of say me too, just to keep it short, and introduce John Kane with Uber to give a little more explanation and answer questions. Thank you.
Thanks, Rob. Chair Beidel, Vice Chair Hayes, and members of the Senate Finance Committee. I'd like to begin by thanking Senator Gazzone for sponsoring this important legislation. SB 786 represents a vital step forward in modernizing Maryland's paratransit system to better serve residents with disabilities while ensuring fiscal responsibility for Maryland taxpayers. Under the current system, paratransit fleets often operate at or over capacity, leading to leaving residents stranded for hours at a time, waiting to be picked up by their service. SB 786 provides the tools to manage peak demand and reduce missed trips. Traditional paratransit trips cost the MTA approximately $64 per trip. Shifting just 20% of those 3 million annual trips to a TNC supplemental model like Uber or Lyft could save the state over $24 million annually. It takes a forward-thinking approach to explore these regulatory updates to make changes that save the taxpayer money and modernize the framework for residents. Alongside other innovative large-scale agencies like WMATA, MBTA in Boston, and over 80 different transit agencies across the United States, Maryland could accept and use TNCs to drive down costs and reduce wait times for your most vulnerable riders. In short, SB 786 removes certain administrative requirements designed for direct employees while maintaining comprehensive annual background screenings. And these annual checks meet some of the highest security standards in the transportation industry. As Rob and the Senator mentioned, this model is being used by over 18,000 Maryland residents already through the WMATA program, and that's over 450,000 trips per year. Meanwhile, Pennsylvania, Boston, and others also run similar programs that reduce wait times and save costs. So from our perspective, this is a very simple, innovative approach to save taxpayer money while improving outcomes for your most vulnerable populations. Respectfully urge a favorable vote on SB 786. Thank you.
Good afternoon, Mr. Vice Chair, members of the committee. I'm Rachel London, the Executive Director of the Maryland Developmental Disabilities Council. We are a statewide policy organization that creates change to make it possible for people with developmental disabilities to live the lives they want with the support they need. You have our written testimony that is signed on by three of our partners, the ARC Maryland, Max, and People on the Go. And we all work together to improve the opportunities and outcomes for people with developmental disabilities. And this bill does just that. A couple of things I want to mention for people with developmental disabilities. Transportation options are cited as one of the most critical issues. And the lack of options is cited and has been forever as one of the greatest barriers to participation in community life. The ability to use TNCs, other options, increases the possibility of being included in community life, and it provides even more flexibility for people. The second thing I want to raise is some people have raised concerns that these changes in the bill put people with disabilities at risk, especially regarding safety. But true access to the community means recognizing that we all share the same dignity of risk. The right to make choices, take chances, and fully participate in the world around us. Expanding transportation options is essential to making that participation real, to making sure people with disabilities can independently and reliably connect to work, to healthcare, and community life, whatever that looks like for them. So for these reasons, the council and our partners support this bill.
Excellent. Thank you. Are there any questions from this panel? Senator Kramer.
Thank you, Mr. Chair. Rob, let me ask you a question. This sounds like a great bill, and it's going to serve a very meritorious purpose. But there's just, and I'm curious, and I don't understand the logic, and maybe you can address that for me. And I'm just going to read from the fiscal and policy note. I see where it is in the bill. So I was going to read from that, but I think the fiscal and policy note provides the question. It says this bill exempts a transportation network company that contracts with the Maryland Transit Administration to facilitate the provisions of transit services, et cetera, that it exempts them from the general requirement that individuals who provide transit services to persons with disabilities receive a state and national criminal history records check through the Criminal Justice Information Center, and instead just replaces that requirement with an annual background screening. Why is it that we, as part of this bill, feel that we're, I think, reducing the public safety portion of this with regard to everyone else? We're taking it away for residents with disabilities who might avail themselves of this service.
So thank you, Senator, for the question. If you look at the first page of the bill or the second page of the bill, you'll see the beginning of the TNC statute, which outlines, and it's really the gold standard for safety and background checks that was put in place in Maryland about 8 or 9 years ago, I believe, when the TNC Act was enacted. And when it was enacted, it was seen as the gold standard across the country. That language there is what's applicable for Montgomery County residents that are using WMATA that is also applicable in Prince George's County for those residents there that are using WMATA. I wouldn't look at it as lessening because I don't think it actually is lessening. It's different. And what was said earlier is the provisions in the existing law, if you look at page 3 of the bill, those are more applicable for employees of a paratransit company. There's a fingerprinting requirement. Uber drivers, generally speaking, many of them are not going to take the time out of their day because many of them, I think 72%, it's a part-time job. They're not from their other job or as an Uber driver, take the time to go get fingerprinted. And that's the problem. And that's why not only in WMATA, but in Philadelphia, in Boston, in other areas of the country that Mr. Keene referenced earlier, they've used a similar standard that we're looking to have applicable in Maryland to expand paratransit to TNCs like Uber or Lyft or anyone else for that matter. So it's not a lesser, I would say it's an equal or maybe even a stronger background check requirement, and it would be done annually.
So is the concern that in order to participate in the service, the drivers would not be willing to subject themselves to a criminal background check? Because it does also involve, and let me ask you, is there a distinction between a criminal background check and the addition of the fingerprinting, or is it all one and the same?
My understanding, and I'll maybe turn it over to Mr. Keene to answer this as well. So there's one type of background check that requires a fingerprint, and that's the CJIS system, okay? And that's, national as well. But there are other background check requirements as well, which if you, again, look at page 2 of the bill, it outlines another type of background check that's also national, regional, local, making sure that we're ensuring that under current law, all Uber drivers or other TNC drivers, because that's the statute in Maryland, adhere to that. We've added in the language that we would require this annually, which I believe Uber already does. But I don't think that's existing law for TNCs to be annual. But each driver must go through all of those background checks to become a driver for you and me today outside of Montgomery County, well, in Montgomery County as well, but we're talking paratransit. This is what would be applicable for paratransit, similar to Montgomery County and Prince George's for WMATA. But John may have additional points to add to that.
Well, quick question, would a driver who is seeking to provide these services have already gone through a background check?
Yes.
So they will have had a criminal background check.
And other sex offender registry. There's a number of things on that, if you look at page 2 of the bill, that to be a TNC driver today in Maryland, and again, this was the gold standard when it was enacted. I think many states followed suit. We should be very proud of that high standard to ensure safety of our riders. But that standard would be applicable for participation in paratransit, but it would be required to be done annually.
But my understanding is that that would be replaced with simply a background screening. So that's what I'm just trying to get a handle on. What is going to, in other words, look, I mean, again, I think this is great. I just want to make sure we're not putting at risk a part of the population that would take advantage of this service, and that's great that it be made available to them. But we also need to be very mindful of the public safety side of this.
Of course.
And how we're going to protect those individuals.
That to 3 points. Number one, there's no lessening of standards. I would say maybe even strengthening, certainly equivalent, just different. Number two, I think what Ms. London referenced earlier about, from a dignity standpoint and sharing the risk, that's important for the developmental disability community. Number three, I forgot to mention, this committee and the Senate passed this bill, or a very similar bill, I should say, unanimously in 2022. It didn't get full consideration in the House, unfortunately, that year. We're more hopeful this year based on conversations we're having. But I would argue, as was argued 4 years ago, we're looking at largely an equivalent, if not better, standard with what we're seeking. But the real important thing is right now there's not enough paratransit drivers out there. And so people are being stranded or they're not
No, and
getting
I
the rides
get
that they
it.
need.
Look,
And so
I
what we're-
said the merits are very worthwhile. I just want to make sure in order to provide greater access, we are not also creating a public safety risk for, I think, a population that we need to be very attentive
Absolutely.
to their public safety needs. That's all. So maybe offline, we can have a little deeper conversation just to make sure that we are, again, this population, I feel we just need to be extra cautious
I think Ms.
that we are
Olson,
ensuring their safety when they get into one of these vehicles. And that's all. So maybe we can talk offline and
absolutely. I
discuss
think
it.
the other point that Mr. Kane made, I think about 18,000 riders a year, 450,000 trips a year that are occurring in Montgomery County and Prince George's County under the exact same standard for the WMATA area that we're just merely looking to have applicable to MTA and RTA.
Okay.
But happy to
Thank you,
continue the
Mr. Chair.
conversation.
Senator Lamb.
Thank you, Vice Chair. Thank you to the panel. Good to see all of you. So I was just looking through the bill folder, and there's a favorable with amendment from ATU Local 1764. And they bring up a point here that, and I'll just read briefly from the letter here. They believe that this bill might be targeted just at MTA's call-a-ride service. If that's the case, they believe that an amendment to the bill should be put forward to limited scope just to contractors for call-a-ride. One is, was that the intention to, with this service, to really address the call-a-ride service that MTA has? And two, would you be open to an amendment?
Thanks for the question, Senator. I think the call-to-ride service is the most obvious, quickest way that we could participate in a program like this. But really, we're just looking for the ability to participate in the market in general. We think we can bring a lot of innovative solutions to the call-to-ride program, but also MTA and even RTA and elsewhere in Maryland where they might have paratransit services. One thing that, and maybe to the previous question as well, is the call-to-ride service has multiple providers, a bunch of different options, local taxis, TNCs, things like that. And we just want to be an additional option there. And that's kind of the magic of this. No one in a paratransit program has ever put in an Uber without them choosing that. We're not replacing something with just Uber. We're adding Uber as an augment to the services available, as was mentioned, and giving that rider the choice. And so while I think the call-to-ride program is the most obvious initial fit for us, we would love to be able to participate in any potential future programs or bids or things like that and win on our merits.
So would you be open to an amendment that would initially limit this to the call-a-ride service with the intention that, if that goes well, to come back to be able to expand that beyond just that service with MTA? Or what's your appetite for this amendment?
I think from our perspective, we'd just love to be able to compete and let the MTA leadership choose of whether Uber's the right choice or TNCs are the right choice for their programs. They know their riders best and are able to make the best choices for them. There are certainly some situations with some riders where we wouldn't be the best service for them, and they know that better than anybody. And so my ask to you would be able to let us participate in the programs and let your leadership at MTA choose when it's appropriate to include us as an option for riders.
Okay. Thank you.
Senator Kramer.
Yeah, one more quick question, Rob, because I really, look, like I said, great bill, but I want to make sure we get it right. Have you consulted with the Department of Disabilities to see if they have any thoughts with regard to this issue of background checks or just, again, ensuring the protection of those who would be availing themselves of this service? Is that something that has happened? And if not, maybe before you and I discuss it further, maybe you'd be willing to do that? Let's get some feedback from them.
Let me defer to Ms. London on that because she's been kind of point on outreach to other stakeholders in that respect.
And I don't want to speak for the department because, of course, departments take positions based on the department that it most affects. And I don't believe the Department of Transportation has taken a position. I can tell you in general, they focus very, very, a lot of resources on expanding transportation options. We have talked about it, and I would be more than happy to follow up and get, something official. But I don't want to put them in that position, but we do talk about this a lot. The council partners with them very, very closely. So I will do that and get back to you, Senator.
Yeah, I just want to make sure we get it right. So thank you. Okay. Thank you.
Any other questions? No other lights. Thank you to this panel.
Thank you.
I don't know, Senator Gazzoni, I was out of your meeting in about 2 minutes, so
I know.
my apologies.
That's the way budget and tax is.
That's okay, as long as they pass my bill, it's fine. I think we have Renelle Cole from ATU. And she's favorable with amendments. Thank you.
Good afternoon, Finance Committee. That was a lot. Good afternoon, Chair, Vice Chair, Finance Committee. I am here in support of 786, representing 1764 and all of the paratransit operators, mechanics, dispatchers, and the vulnerable committees that we serve. The bill posed before you, we do not agree, okay? As Senator Lamb says, we would like it to be, if it is passed, solely to the call rides, okay? If the panel's issue or their concern is transportation, our solution would be put more funding into our fleets, okay? If we have customers that are being picked up or not being picked up, that's due to funding, the lack of funding for the wages for the operators, the lack of funding to upgrade our fleets and our software that we have continuously asked for. If the panel's position is that we need more, again, transportation, I do not think that is to be outsourced to Uber or Lyft. Our operators go through vigorous training as far as customer service, as far as operating the vehicles, as far as professionalism. What does a Uber or Lyft driver offer in that situation is my question. How do they transport the customers with the most vulnerable disabilities? How are they able to handle a crisis in that moment? Again, our operators are trained vigorously. They go through background checks continuously from the moment they're hired until the moment they separate themselves. That is an ongoing process, not just annually. I would ask the panel again, what the TNCs protect, as Senator Kramer was asking them. What is the protection for the operator? What is the protection for the vulnerable people that they're picking up? If that customer has an asthma attack, if they pick them up from dialysis and the dialysis stunt is now leaking, how does a Uber operator, are they trained to handle that is our question. Our operators have been vigorously trained across all providers, prepared to handle any of those situations. Again, if the question is that we are not picking people up on time, invest in our fleet, invest in our software so that we can do that. Unfortunately, this is a turnaround business, so therefore operators come and go. But if we invest more and show the people that we are here to support not only the operators, but also the people that we pick up, I believe that would solve everyone's problem. Thank you for your time today.
Testimony. Do I see any questions? I don't see any questions. Thank you very much for being
Yes,
here.
ma'am.
That ends the hearing on Senate Bill 786. Do we want to do 570? Senate Bill 570 is next. Senator Ellis, Public Health Baby Food Testing, definition of baby food. And I think you're going to bring Riley Roshog up with you, right? Oh, she's virtual. Okay, so we'll also hear from her. Thank you.
Good afternoon, Chair Bidle, Vice Chair Hayes, and member of the Senate Finance Committee, Senator Arthur Ellis, representative District 28, Charles County, Maryland. Pleased to present Senate Bill 0570. Public health, baby food testing, definitions of baby food. Senate Bill 570 redefines the term baby food to ensure that designated baby food products are included in regulatory testing, including infant formula and infant cereals. This bill requires that manufacturers of baby food products conduct regulatory testing to ensure only the allowable amounts of toxic elements designated by the U.S. Food and Drug Administration, which are acceptable for consumption, are present in baby foods. Manufacturers are required to provide a QR code or a machine-readable code that allows consumers access to laboratory test results on toxic elements found in baby food products, and a link to the U.S. Food and Drug Administration webpage with the most recent guidelines on the health effects of toxic elements on children. What's the impact of this bill? By expanding the designation of baby food to include both infant formula and infant food, conducting tests on such products and producing test results for public review will ensure transparency from independent proficient labs so that families can make informed decisions when feeding their infants. Just want to say that everyone is on board with this bill. I wish all my bills were like this, they're all favorable. Everyone's in favor of taking care of the babies. So colleagues, I ask for a favorable report on Senate Bill 0570. Thank you for your consideration.
Thank you, Senator. We're going to have your virtual testimony and then ask questions, okay?
Yes, ma'am.
So Riley, you want to unmute and give us your testimony, please?
Yes, of course. Hello, Chair Bidel and members of the committee. Thank you so much for allowing me to testify. My name is Riley Grace Hirschong, and I'm a family advocate attorney with the Green and Healthy Homes Initiative. This bill actually has a lot to do with its legislative history. So I actually want to focus a lot of my testimony on that just to bring that to your awareness. So the language that this bill is modifying was first actually enacted in 2024 as part of Rudy's Law. And Rudy's Law was heavily based on a similar law that California passed that prior year in 2023. Now, interestingly, neither California's law nor Rudy's Law originally excluded infant formula from how they define baby food. Instead, both were similarly amended after being introduced to explicitly exclude infant formula, and here's how it seems to happen. From what we could tell, it seems that in California, the state Senate amended their 2023 bill, that's AB 899, to exempt infant formula primarily in the face of industry opposition. Then in 2024, in our bill, the only oral testimony I could find referencing the California law was in the first Senate Finance Committee hearing from Rudy's Law from February 29, 2024. And that was testimony originally in opposition, then changed to neutral from the Maryland Retailers Association. From their oral testimony at about an hour, 33 and 50 seconds in live stream, they argued that we should bring our law into alignment with California's law. I think that's how we got here. Now, the reason I would be concerned about that, and the reason I want to, the reason why we're supporting this bill is because what seems to have happened is that we mainly just took California's lead on introducing this exclusion to infant formula. And I worry that we may have been mistaken with that decision, since again, this primarily came to be in the first place from lobbying efforts from private manufacturers, despite recent studies showing the presence of toxic heavy metals in infant formula. I want to be respectful of everyone's time, so I can talk about that, legislative history in California, and the studies that are relevant to this more for questions and answers, or I can follow up. I also want to touch briefly on the testimony from the Maryland Department of Health. Actually, I can't, but I can also talk about that if necessary, and we support this bill. Thank you.
Thank you, Riley. Okay, so do I have any questions for the senator or for his witness? I don't see any questions, Senator. Thank you.
Thank you, Madam Chair. Thank you,
We're going to
committee.
bring up Craig Fellner from the Infant Nutrition Council with information. Is Craig here?
Yes, ma'am.
Oh, there you are. Thanks, Craig.
Good afternoon, Chairwoman and members of the committee. My name is Craig Fellner. I'm the Government Affairs Director for the Infant Nutrition Council of America. Inca represents several of the leading domestic manufacturers of infant formula. Infant formula is the most highly regulated food in the U.S. food supply. Our industry currently tests for heavy metals under various international standards as part of our long-standing commitment to provide safe infant formula products. While Inca appreciates the intent of SB 570, this proposal overlooks important differences between infant formula and the baby foods currently covered under existing law. FDA announced recently its intent to set formula-specific action levels as part of Operation Stork Speed, an effort we support. HHS has also announced it will publish a report in April on heavy metals, a precursor to setting federal action levels. We are also concerned that SB 570 would require infant formula to bear a statement about, quote, toxic element testing, unquote. This word toxic is not only inaccurate as it relates to trace levels of heavy metals in infant formula, but potentially alarming for parents. Again, the FDA has stated that heavy metals in infant formula do not indicate, quote, a public health concern, unquote. Absent such a demonstrated concern requiring formulas to bear the word toxic might mislead parents and caregivers into thinking that these products are unsafe. We do not recommend any actions that might unjustifiably erode confidence in U.S. infant formula that meets all FDA requirements. Further, it is important to note any product labeling changes required to comply with this proposal would be functionally required nationwide as retail partners determine product distributions, not infant formula manufacturers. This council is in favor of keeping Maryland's current law approach that has only been on the books for 6 or 7 weeks, which mirrors the approach of California, Virginia, and Illinois. Thank you so much for your time, and I'm happy to answer any questions.
Thank you, Mr. Fellner. Do you have any questions? Oh, Senator Washington.
Thank you, Madam Chair. The chair said you signed up for information, but it sounds like you're against this bill.
We want to work with the sponsors of this bill to try to provide some sort of transparency and some sort of ability for parents to learn more about heavy metals.
Yeah.
And I wanted to provide, just like I did in the House, just some information as far as, look, baby food and infant formula are totally different. The current program is baby food. Baby food is treated like it sounds, a food. Infant formula is the only thing in the grocery store that has to be pre-approved by the government. They are prescriptive of what we need to put in there for nutrient, the amount of fats, the amount of sugars, that type of stuff. And they approve every product before it gets put on the shelf. We at the at Inca and our members have specific programs that the FDA tells us we have to do to start testing ingredients once it gets inside of our manufacturing sites. And so that's the information I wanted to provide, because there's just a lack of understanding and information regarding the difference between infant formula and baby food.
And just so folks know, you don't work for a government entity. You work for the Infant Nutrition Council of America.
Right.
Right. And so that's totally separate of any government entity, FDA, or the state of Maryland. Is that right?
Oh, no. It's a trade association.
It's a trade association. Got it.
Several of the leading U.S. manufacturers of infant formula. That's correct.
Got it.
Yes,
Okay.
Senator.
But you said something that alarmed me, and I think alarmed some of my colleagues just looking around at their faces when you said that some form of heavy metals are not dangerous in, I can't remember if you said in formula or in baby food. Can you explain that? Because that just contradicts everything that I kind of believe what our kids should be eating. And just take us back. Why is that the case?
Yeah, that's a great question. Thank you so much for asking it. Heavy metals are omnipresent. Heavy metals are in the earth, they're in the animals, they're in the water. They're in the food that adults eat, they're in the food that children eat, they're in components or ingredients that we bring in to make infant formula. For example, dairy. So once we know there's going to be trace amounts of heavy metals once the dairy components come in. And so we start testing it right when it comes to our facilities. And your observation isn't unique. And that's one of the reasons why I'm here today as well. With trace amounts of heavy metals in infant formula and trace amounts in the food supply generally, our job as infant formula manufacturers is to get that closest to zero that we can get. Now, as I noted in my testimony,
If you make the claim that it's not dangerous, then why do you want to get down to 0%?
so we know that heavy metals at high exposure for a long amount of time, that could be problematic, okay? And so what we do as an industry, absent US standards right now, which are being set or being on a glide path to being set right now by the administration, we test under international EU standards, which are the most stringent in the world. And so we're just not sitting back, because the biggest thing that we want is we want moms and dads to be comfortable with buying our product. Because remember, if a mom or dad makes a choice to go buy infant formula and give that to their baby, most of the time they have come to that choice after trying to breastfeed, or they breastfed as long as they could. And for most moms and dads, that's not an easy decision to make. And so there's nothing that's more important to us as an industry than making moms and dads feel comfortable. And given the trace amounts in the ingredients that we bring in, we test the ingredients and we test the final product currently to EU standards, bless you, and around the world.
Got it. Matt, last question. You said something earlier about the amount that there's a test or study already going on, or you're initiating a study about heavy metals. When will that be complete? Who is conducting that study? Can you answer this question?
Yeah, no, great question. Because my testimony went very quick.
I know. I was listening.
2 minutes goes really fast. So what I was alluding to is the announcement by the current FDA to set heavy metal standards for infant formula. There is an initiative that was started at the tail end of the Biden administration that the current administration is continuing that is called Closer to Zero. And they're setting standards for baby food and then eventually infant formula. That announcement, or that point that I made in my testimony, was the current administration saying there's an NIH study coming out in April. And we have been told that that NIH study is a precursor and will be used to set a federal standard. We have, just so everybody knows, for some time now, our companies have been sharing our heavy metal testing data with the FDA in hopes, because we support it, in hopes of them getting to a federal standard very soon. And so in the meantime, you could just be assured that we test to international limits. The most strict of it is the EU.
Thank you.
Yeah, thanks so much. Those are good questions.
Well, I appreciate it.
Senator Ellis?
Yeah, thank you, Madam Chair, and thank you, colleague, for those good questions. Thanks again. You know, so, sir, you said there are no federal standards in this area, so you look to international standards to guide what goes in baby food. Did I hear you correctly?
Yes, sir.
Okay. Yeah, okay, great. I'm sorry, I didn't hear your answer.
Yes, that's correct.
Yes to there's no
current federal U.S. standard for infant formula heavy metals. And so in the absence of that, for years, we have looked to international standards.
Yeah.
The strongest among them is the EU.
And so you also said earlier in your testimony that you respond to governmental bodies and their instructions. So do you know that this is a governmental body who want to kind of put some standards in place?
Yes, sir. I was really alluding to regulatory bodies versus legislative bodies, but obviously we have immense respect for y'all and what you do.
Yeah,
and
well, it didn't sound that way. So in the absence of federal rules, we at the state want to make a statement to say, hey, this governmental body, your industry must respond to. And sometimes individuals come in and they can't say we are opposed certain things, right? You can't say you were opposed to healthy baby food, so you come in as information and then you basically go against bill, which I sense this will happen today. But let me just say, a letter from the American Academy of Pediatrics in support of this bill. This is the Maryland chapter. There are more than 1,100 pediatricians and healthcare practitioners taking care of babies in this organization, and they strongly support this bill. The goal to expand coverage under the prior heavy metals and baby food laws, it is entirely appropriate and necessary to include infant formula and infant cereals within the scope of required testing. Infants are uniquely vulnerable to toxic exposures during critical stages of development, and products intended to be a primary or sole source of nutrition must meet the highest safety standards. So in the absence of the federal government not doing the job, we in the Maryland General Assembly would love to do the job and take care of babies. Thank you, Madam Chair.
I don't see any other questions. Thank you for the information. This ends the hearing on Senate Bill 570. Senator Washington, Senate Bill 865, Work Group on the Affordability of Private Passenger Automobile Insurance. And you have a panel of Michael DeLong, Al Redmer, and Marie Grant.
Yes, we can have the panelists come up. That'd be great. Thank you, Madam Chair, members of the committee. For the record, Senator Alonzo Washington here to present on Senate Bill 865, which we had a lot of discussion about already this year. The work group on affordability of private passenger automobile insurance was established to study the affordability of private passenger automobile insurance and report its findings and recommendations to the General Assembly and to the Governor and the General Assembly. This bill in front of you it's a simple bill that extends the reporting deadline from June 30th, 2026 to June 30th, 2027. It allows for a longer timeline for the work group to develop actual policy recommendations that target racial disparities and PPA insurance affordability. It also adds 2 representatives of nonprofit research or consumer advocacy organizations with demonstrated expertise in automobile insurance rating practices and affordability to the membership lineup. It also allows for visibility and representation from the consumer side during deliberations. Lastly, it replaces the representative from the House of Delegates because of the significant changes that happened there with their committee structures from the Economic Matters Committee to align with where insurance lies in currently the Judiciary Committee in the House. This bill, the problem that we have right now is that the work group was created to study affordability, and it did identify some serious disparities in auto insurance pricing. The work group acknowledged that territorial rating and other non-driving factors contribute to geographic and racial disparities. But despite identifying the problem, the work group did not produce legislative recommendations to reform the rating practices. The core issues, especially territorial rating, were kind of kicked down the road here, which we heard from before. And again, the MIA director has been fantastic. And she's sitting right, I'm not saying that just because he's sitting right next to me, and led the work group. The General Assembly was left without actionable guidance on how to fix the problem. The makeup of the work group did not sufficiently reflect consumer interests, which limited its ability to advance reforms focused on affordability. This simple bill fixes that process failure by giving the work group more time to do their job right and ensuring consumer and research voices are present when recommendations are developed. Maryland consumers face the 8th highest average expenditure on auto insurance in the country. Safe Maryland drivers with poor credit scores paid $1,600 more than convicted drunk drivers with a high credit score. The low-income zip code in Baltimore of 21216 is 95% African American and has a median household income of $40,000. That zip code pays an average annual premium for auto insurance of $2,400, over about $1,000 more than the average premium in Silver Spring zip code, and almost $1,400 more than the average premium in the Bethesda zip code. I like Montgomery County, by the way. This bill does not ban or remove territorial rating as a factor when determining premiums. This bill does not establish a standard for what affordability looks like. Here's why this bill matters today, and I hope that we can pass it soon. Auto insurance is not optional here in Maryland. We must carry it to work, care for our families, and to live our daily lives. Safe drivers are paying more not because of how they drive, but because of where they live or their credit profile. That burden falls disproportionately on Black and low-income communities, even when driving records are identical. When a work group identifies harm but produces no solutions, the system stays broken. Without concrete recommendations, the Maryland legislature cannot responsibly act and stop premiums from rising, because we know that they keep on rising and keep on rising. I have not met anyone where their auto insurance has decreased unless they move to another zip code. This bill ensures that this work group delivers data-driven, actionable options the General Assembly can use to reduce unjustified disparities, improve affordability, and restore fairness to the insurance market. This bill is about moving from study to action and doing it the right way with this study. For these reasons, Madam Chair and members of this committee, I respectfully request a further report on SB 865. Thank you.
Thank you, Senator. Who would like to go next? Marie or?
Yeah.
Okay.
Thank you, Madam Chair, Vice Chair Hayes, committee members, Marie Grant, on behalf of the Maryland Insurance Administration, here to support this great bill. I think a couple of things. First of all, we actually do have departmental legislation that's starting in the House that is reconstituting this work group to look at a low-cost auto option. And so we're planning for this work group to be reconstituted anyway. And I think that the second thing, I don't need to repeat all the great points Sarah Washington made, but territorial rating is something we need to take a look at. We took a look at as part of the auto work group and didn't come to an agreement, but it's an important issue to inspect and make sure we're getting right in Maryland. And so for all of those reasons, we're happy to support this legislation.
Who's next?
Thank you very much. I'm Michael DeLong, a research and advocacy associate with the Consumer Federation of America. We strongly urge your support for SB 865, which will restructure the auto insurance work group to make recommendations on reducing auto insurance costs and ensure that consumer voices are heard. Rising auto insurance costs have made auto insurance expensive and even unaffordable for a lot of Marylanders. Premiums have gone up while auto insurers have been earning big profits, and the companies use a whole bunch of non-driving rating factors such as your credit score, your education level, your job, or occupation, your zip code or neighborhood to charge people higher premiums. And a territorial rating is one of these, and we did a report in 2021 with Economic Action Maryland and found that Maryland residents of mostly African-American zip codes paid a lot more in auto insurance premiums, often as much as $1,000 more compared to residents of mostly white premiums. We also found that credit scores are especially harmful to consumers. We did a 2023 report, which we're happy to share with you, that found that Maryland drivers with excellent credit paid on average about $800. Maryland drivers with poor credit paid on average $1,422, or 77% more. And so this bill would encourage reforms to reduce auto insurance costs. It requires the work group to develop data-driven, concrete recommendations to lower premiums, including recommendations about territorial rating. And it will also include two representatives from consumer advocacy organizations who are experts on auto insurance, who can provide useful insights and help the legislature determine what to do next. So we thank Senator Washington for his work on this bill, the commissioner for her support. She mentioned a low-cost auto insurance program, which is a promising option, and we have experience with that in other states, and we're happy to help out however we can. We strongly urge a favorable report on SB 865, and happy to answer any questions. Thank you.
Mr. Redmer.
Thank you, Madam Chair, and I know we'll have the opportunity to do this later, but as I said privately, I want to publicly thank you for the leadership that you have shown over the years, and I'm sure we'll have other opportunities to say so, but I wanted to make sure that I express that. I also want to thank Senator Washington for being a consistent voice on the issue of affordability in the auto insurance market. As you know, the General Assembly created us 50 years ago, 40 years ago. They asked us to begin looking at affordability because the General Assembly recognized that affordability is a reason why some folks drive uninsured. We've been doing that for 40 years. Experian just recently rated us as, if not the most expensive state for auto insurance, it's one of the most expensive states. If you look at the report from the affordability work group, you'll see that third-party testimony went through the laundry list of issues why having high cost is disruptive, particularly in low-income urban areas. A reminder that the Maryland Auto, more than half of our policyholders are with us not because of bad driving records, but because of financial challenges that the rest of the industry won't take. So the commissioner of the MIA did a terrific job leading the work group, and we support continuing the work group and any efforts to expand opportunities to ensure low-income policyholders in high-cost communities. We're looking forward to participating in the work group and can assure you that Maryland Auto has the experienced, mission-driven workforce that's committed to execute and deliver whatever recommendations come from the work group. And with that, Madam Chair, we support Senate Bill 865. Thank you.
Thank you. So Senator Guile?
Thank you, Madam Chair, and thank you, Senator, for this bill. I know this is a really important issue, and I know it's something that you've been a leader on, so I thank you. So I served on this work group, and if we move forward with extending this, not that I don't love talking about affordability, I might be a little busy this year. So I just want to get a confirmation. I think you may have a little bit more time than me.
I think I do.
That you might be available to sit on this work group. You got time?
I do got time.
All right. Let the record reflect. Senator has time. Thank you, Madam Chair.
Well stated. Senator Hershey?
Interesting. Yes, of course I am. Just a couple quick questions. And again, I do appreciate the sponsors, identifying this and just trying to continue to move this needle. But I do want to take a look at some of the opposition. Ms. Grant was here and it talked about, and I've said for a while, we always get caught up in these preamble sections of the bill and the whereas statements. And some of the opposition said that the actual whereas statements might not be correct. And in passing a bill, I just want to make sure that those concerns are addressed, and it's specifically when it talks about the report that you're just part of, identifies significant disparities in affordability, and then talks about identifying territorial rating and other non-driving factors. With that being in the preamble and the way that the bill is written, are you concerned at all that there might be some predetermined, or we might be pushing some predetermined outcomes with respect to the work group and what you're trying to?
For me?
Senator, you can be.
Sure, thank you.
Yeah.
Thank you for the question. Yeah. And what's crazy is that I figured that would be a question, so I asked my staff to look back at the report.
Right.
And I have my phone sitting on my desk, so I'm going to show you where it identifies that some of that statement is true. But obviously, there's an amendment process, and we can amend some of that out just to make it clear.
Okay.
I don't plan, again, this bill is not about setting the rate, setting what affordability means, setting what territory is or what it should be. It's about the work group getting back together, coming up with concrete, data-driven, evidence-based recommendations so that we can move here in the General Assembly.
Great.
And that's it.
I appreciate that, and I think that'd be fine too. Okay, thank you. Thank you, Madam Chair.
Thank you. And my Vice Chair, Hayes.
Thank you, Madam Chair. Senator Washington, I just want to make sure you're oral testimony was consistent with your written testimony. You used some adjectives to describe the head of MIA, like fantastic. Was that reflected in your written testimony?
Yes.
Cool. No, I do, all seriousness, I do want to give you a chance to respond. Similar to Senator Hershey, in the testimony that was provided to us, there was some concern that it was stated by the American Property Casualty Insurance Association that there has already been a work group, they've made some recommendations, and those things have just gotten started. And so, and this is for anyone, whoever is best to answer this question, and their concern is they just haven't had a chance to mature in that process to see whatever results that's happened. But it didn't sound like there's some agreement that the work group went further enough. And so I'm curious, with this opposition, how would you respond to that testimony?
Yeah, thank you. I think how I respond is to that, it's the work group made some recommendations, but they kicked the can down the road when it comes to territorial rating, disparities that exist. I mean, it was at least 7 or 8 different line items that said, oh, we'll continue to study. So what I said was, hey, we're going to hold you to it and continue to study it. And so that's what this bill is. They're moving on some pieces. This is a really important piece around affordability. We should be able to quantify what that affordability looks like in this work group too, and present that to the General Assembly saying, hey, here's a measure that we believe is going to work, and it's going to drive down costs for Maryland premium holders.
I don't see any other questions. Thank you for your testimony.
Thank you.
We've got a little bit in opposition, as you can imagine, some unfavorable. Gina Rotuno, Bryson Popham, Robert Enton, and Nancy Egan. All my friends. Mr. Popham, would you like to start, please?
Thank you, Madam Chair. Members of the committee, Bryson Popham appearing on Senate Bill 865 in respectful opposition on behalf of my clients, the Maryland Association of Mutual Insurance Companies, and the insurance agents and brokers. May I say, Madam Chair, it's not my written testimony, but I think you're fantastic. So, having gotten that off my chest, I want to say this is the first time in my career I've appeared behind the insurance commissioner, taking a different position on a bill that she's taking, and essentially agreeing with her on the substance of the bill. And that means, Senator Washington, I'm agreeing with you on the substance of the bill. I mean it sincerely when I say I admire your passion, your conviction on the subject of territorial rating. I've heard you many times, and I respect your position on that. My opposition to the bill, however, is simply because, not be nice, Mr. Vice Chair, is because of the difference between form and substance. The substance of the issue needs to be addressed. Indeed, on January 22nd, when the commissioner sat at this table, she said territorial rating is important. You'll recall that. She also pointed out another state that she was looking at the time. So she is doing her job for you. She is your guide through this difficult process. And I think we need to let her do her job. You mentioned the form, and that is really where I respectfully disagree. I think that we had a work group. There's going to be another work group on low-cost auto, another big issue. I think you'd agree. But I don't think it's appropriate to have a work group on a single rating factor like territorial rating. It's important, don't get me wrong, but I don't think it deserves a separate work group. We can cover the issues that are raised in the bill, and we should, Senator, within our existing resources. And for that, Madam Chair, I respectfully request an unfavorable report.
Thank you. Gina?
Good afternoon, Madam Chair and members of the committee. Thank you for the opportunity to be here today. My name is Gina Rotuno, and on behalf of the National Association of Mutual Insurance Companies, we must respectfully oppose Senate Bill 865. We appreciate the committee's continued focus on affordability and access to auto insurance. The existing work group has already devoted significant time to these issues, and its recent report offers thoughtful recommendations, several of which, like the low-cost auto study outlined in House Bill 1583, are just beginning to move forward. Letting these initiatives unfold will help ensure we have the most complete insight into what works for Maryland drivers. We also know that the Maryland Insurance Administration has already committed to reviewing territorial rating, which means much of the analysis envisioned in Senate Bill 865 is already underway. Finally, if the work group is expanded, NAMIC would welcome the opportunity for additional insurer actuarial expertise to be included. Having a broader range of technical voices at the table would ensure the group's work remains balanced and data-driven. Thank you again for your time and your commitment to improving Maryland's insurance marketplace. For these reasons listed, we must respectfully oppose Senate Bill 865.
Thank you, Gina. Mr. Unton.
Thank you very much, Madam Chair, and I certainly share Mr. Redmore's grief over your announcement today. You will be sorely missed. Robert Unton on behalf of the American Property Casualty Insurers Association. We are signed up in opposition. You know, the commissioner conducted a very, and Senator Gall was on the group, a very, very broad, very, very thorough analysis of these issues and made a report. And the report is 56 pages long. That's how detailed the report was. What concerns us about the senator's bill, and with all due respect to the senator, is if you look at the preamble, it almost, it kind of almost reaches an assumption that, identifying territorial rating and other non-driving rating factors as key areas of concern, major policy issues affecting affordability, including territorial rating. This work is necessary to produce data-driven additional recommendations. All these things were broadly discussed by a very, very balanced group of representatives from the insurance industry, from consumer groups, agents, you name it. One of the areas of concern that we have with the bill is that it calls for voting, and now you're going to have, an up and down vote with this group. And secondly, it adds 2 new members. I thought that the membership was very well balanced last time. It was a robust discussion. Everybody got to say what they wanted to say and discuss it, and it's all in the report. Now we're going to add 2 representatives of nonprofit research or consumer advocacy organizations. We object to the change in the membership. We think if the commissioner wants to conduct a further work group, she has all the authority in the world to do so. That's why we're opposed. Thank you.
Thank you. Nancy?
Good afternoon. Nancy Egan from American Property Casualty Insurance Association, and you will be sorely missed. We appreciate working with you over all the years, first here as APCIA and also when I was with the MIA. It's always been a pleasure. Now I forgot where I was. Senator Washington, I appreciate your active engagement about territory. I know back in 2023, you submitted a bill about separating the territories into 5 equal parts, and that bill did not succeed. In my testimony, I provided a graph of what the impact of territory would be if you banned territory altogether. And what would happen, there would be a shift in who pays what. And in that analysis, if you got rid of territory, 54% of the population would pay more and 46% would pay less. So there's a question of affordability. Who's paying less and who's paying more? That's for the General Assembly to decide. I served on the work group, and I thought if you look in the territory section, Commissioner Grant did a thorough research of all the different options that are provided throughout the United States for different options. For example, there's one in Connecticut right now where some of the territory is weighted based on the overall experience versus specific experience, which after the task force completed its study, Commissioner Grant committed in the January hearing briefing to you all that she was going to further examine territory over the interim. I agree that we appreciate her taking a deeper dive. I think with her tools and behind the scenes that she can do with her tools a much thorough examination of territory and provide her outcome. As already been said, we object to the addition of 2 consumer groups being added to the work group. In all fairness, we say that you should add an additional insurer and then to provide a person from the Actuarial Society who actually is a neutral party that would be able to analyze any data if the work group should move forward. And with that, we ask for an unfavorable report. Thank you.
Are there any questions of this panel? Senator Washington.
Thank you. Thank you, Mr. Chair. And thank you guys for being here. You guys, thank you for all the compliments too. So I'm gonna be nice as well. The question was about, the first you mentioned that you think that the administrator should be able to do this on her own and, by her, with their own resources. So you want the commissioner to do this to decide whether or not we have territories or keep the same process or make any changes by themselves and without any public input, without input from you guys or input from anyone else. You just want that to happen by itself. Is that what I'm hearing? I'm asking this young lady at the end because she's the one that said it. No, not you, Bob. This young lady right here.
I know that she would have input from all interested parties, but I think that she also has the tools to look at the different rating factors because we submit all our rates to them. That's why my
under the work group, when you all, when you guys did really great work, I read the report front and back, and you guys reviewed different ratings. But when it came to territories and others, is it true that you said there should be more study? That the work group says if you review territories, we should look at it. We should look at it more. The General Assembly should study this more.
Well, I know that there was no consensus.
Is it true that the report says that?
Well, there was no consensus on that specific issue.
No, it was consensus that you all said that you should continue to study it. Is that right?
Well, I have the report here. I'd have to find the specific
It says in the study
recommendation.
that there was a consensus that you all said should continue to study territorial rating, and that's exactly what this bill is doing, to continue to allow you to do your work, and as a group, in public setting, so it's not in the back room of anyone else, and no one's making an assumption of where it should be. If the preamble is something that's an issue, then we can remove the preamble. That's not a big deal. And then we can continue to study this area because it's important. We're talking about affordability. In this work group, I tried to search many times in the work group that you all came together, and I tried to figure out, okay, how much is these recommendations from this work group is going to help car insurance be more affordable? How much is it going to save premium holders? Can you name in there where you guys came up with a calculation that said you're going to save, because it's a work group on affordability, where you're going to save actual money for the premium holders? Is it anywhere in the work group that's in the recommendations that say that? Sure, yeah, of course.
I wasn't on the work group. My clients weren't on the work group, but they participated in the work group's work. And what I would say to you, Senator Washington, is, again, I admire your passion on this issue, and I would respectfully suggest that you let the insurance commissioner serve as your guide. You make the policy decisions. And she said in January, and I think again today, this is an issue that needs to be studied.
Thank you very much.
Senator Washington, I did want to, sorry.
One question to one witness. Thank you. Do we have any other questions? Any other senators? Thank you very much for your testimony. That ends the hearing. Our virtual witness is not online. So, thank you. All right. So our next bill is Senate Bill 739, Climate Change Homeowners Insurance and Emergency Management Study. Senator Kramer, you have Preeti Emmerich, Kevin Kennelly, and Marie Grant at the table. Commissioner Grant, I hope you packed lunch. Looks like you're staying the day.
She's earning her paycheck today. Good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. Ben Kramer introducing Senate Bill 739. Colleagues, this bill requires the University of Maryland to conduct a comprehensive study on the impact of climate change on property and casualty insurance markets and on Maryland's emergency and disaster preparedness systems. This legislation is both timely and necessary. Across Maryland, homeowners and small businesses are experiencing significant increases in property insurance premiums. These increases are not hypothetical, they're happening now. Nationally, property and casualty insurers have reported historic losses driven by extreme weather events. Severe convective storms, particularly hail, have become one of the most costly drivers of claims in the United States. Hurricanes, tropical systems have also grown more intense. Inland flooding has become more frequent, and as actuarial models incorporate these trends, premiums rise accordingly. Maryland is not insulated from these trends. Coastal communities face increased hurricane and tidal flood risk. Central Maryland has experienced costly hail and wind events, and inland flooding has impacted communities far from the shoreline. As insurers reassess risk exposure, homeowners are seeing higher premiums, increased deductibles, and non-renewals or tightened underwriting standards. Without a comprehensive state-level assessment, Maryland lacks a clear understanding of how climate-driven risk is reshaping the availability and affordability of insurance coverage. At the same time that all this is happening, the federal government is reducing its role in disaster preparedness and mitigation. The Trump administration has moved to cut the budget and operational involvement of the Federal Emergency Management Agency, FEMA, including reductions to hazard mitigation and preparedness programs that historically have supported states before and after disasters. When federal support contracts, states bear more responsibility for preparedness funding. Local governments must plan with fewer federal resources, and long-term mitigation investments become more difficult to finance. Maryland cannot rely solely on federal intervention. We must develop our own data-driven strategies to protect homeowners, stabilize insurance markets, and strengthen emergency preparedness infrastructure. Pardon me. Senate Bill 739 wisely assigns this study to the University of Maryland, an institution with expertise in climate science, actuarial modeling, economics, and public policy. The study in the bill will examine the measurable impact of climate change on property and casualty insurance markets in Maryland, trends in premium increases and coverage availability, the relationship between extreme weather events, including hail, hurricanes, flooding, and other severe storms, and insurance loss ratios. The adequacy of Maryland's emergency management and disaster preparedness in light of increasing climate volatility, and finally, policy recommendations to protect consumers and maintain a stable insurance market. At a time of rising climate volatility and reduced federal support, informed state planning is not optional, it's essential, And with that, I ask for a favorable report. Madam Chair, I will share with you that I believe MACO has actually signed up in support of a Ben Cramer bill. This is a landmark occasion. I just wanted to flag that. And also the University of Maryland, I think, has reasonably requested funding in the amount of $150,000 to work on all the research that is involved in doing this. They are in support of the legislation. It seems to me that the CEF fund is perfectly appropriate for this kind of study. That's why we have the CEF fund. What they are asking is nominal, and I think it's appropriate, and I will discuss with the chair about the prospect of an amendment to provide them that funding. They also have asked to push back the date for the report from January 1 of next year to July 1. I will talk to the cross-file, Delegate David Fraser Hidalgo, see if he is in agreement with that. I think it's a reasonable request because there's a tremendous amount of research to be done here. With that, I'll turn it over to the panel. Thank you, Madam Chair.
Good afternoon. Greetings, Finance Committee members, Chair, Vice Chair. Thank you for the opportunity today to speak on Senate Bill 739. My name is Preeti Emmerich. I am the Local Emergency Manager from Anne Arundel County, and I'm the MACO EM Affiliate President. I would like to thank the Senator. That was a great overview of how the many different areas come together and we talk about disaster preparedness. So due to the effects of climate change, we have seen an increase in the cost and severity of weather-related disasters. Increasing disaster costs not only affect states, but also insurance companies. From 2017 to 2022, home insurance premiums rose 40% faster than inflation. And while those insurance prices rose, so did home prices. Rising home prices means it's more expensive for insurers to rebuild after a disaster, leading to higher insurance costs, causing households to reduce their coverage or to go without. Reduced or no coverage shifts disaster recovery costs to residents, local governments, and state resources. All this, combined with the reduction of federal grants and disaster declarations, leaves Maryland at a reduced capacity, capability to respond, leaves Maryland on the hook for these costs. So let me be clear, there is no help coming from the federal government. It was difficult before, impossible now, and the future is unclear. So it is time for Maryland to step up. This bill requires an assessment of the changing federal policies and funding streams and an evaluation of how federal funding supports emergency management capabilities in the face of decreasing federal support. We know that a weather-related disaster affecting Maryland is not an if, but a when. It has happened and it will happen, and we are concerned. This bill presents an important opportunity to strengthen Maryland's emergency management framework in a sustainable manner through best practices and recurring dedicated funding mechanisms. Thus, I ask this committee to give Senate Bill 739 a favorable report. Thank you.
Thank you. Marie?
Thank you, Madam Chair, Vice Chair Hayes, committee members, Marie Grant, on behalf of the Maryland Insurance Administration here in support of Senate Bill 739. I think there's from our perspective, there's a couple of really important pieces that this study and this work would help us all accomplish together. I think the first is, and we've talked in other settings in this committee, right, about Maryland, our home insurance premiums have been rising. We haven't seen some of the same situations that other states have, but it's certainly best for us to get prepared now for that eventuality and make sure that we understand our markets and how to protect our markets. Some of the innovations that are coming out of other states and that we're discussing a lot at the National Association of Insurance Commissioners have to do with how do we incentivize resilience and investment for risk mitigation to ensure that Marylanders are protected against severe weather events, and also incentivized, right, through potential discounts in their home insurance premiums. So we are working with our national partners on that work. We'd love to bring that work into the study. I think the final thing that's an important look that this study would look at is again, flood insurance, the changing role of FEMA, whether the federal government will continue to support that important product at the same level that it has in years past. So I think all of this is timely. It's urgent that we take a look at it and urge a favorable report. Thank you.
Thank you, Madam Chair and members of the committee. Kevin Canale here on behalf of the Maryland Association of Counties in strong support of this bill. It's not often I get to come before this committee. I'm usually stuck in the budget committees, but because this is such a momentous occasion with Senator Kramer, I knew that I had to come in person and thank him for this fantastic bill, and we are very much in support. I think I echo the comments from my fellow panelists. I'll just say that FEMA is not coming. It's been evident in Western Maryland when we met all of the criteria in those counties for disaster relief, and FEMA said no. They continue to say no. It seems like they're getting out of the disaster recovery and mitigation and preparation business altogether, so we have to respond. We don't want to be sitting here today asking for this bill, but we have to be because we rely on our emergency managers at the local level, and they are stretched. This body, the legislature has made tremendous progress over the last few years, particularly to really professionalize emergency management, and we're very concerned that these folks now don't have the resources they need to keep us all safe every single day. This is a good bill. It's a great step forward to get everybody on the same page and figure out what we need to do and what we can do, and we'd ask for a favorable report, and I'm happy to take questions.
Thank you. Oh, Senator Hayes.
Thank you, Madam Chair. Senator Kramer, quick question. I think in your oral testimony, you referenced the University of Maryland, but when I checked the bill and some of the testimony, the University System of Maryland.
I can't hear you. Can you just speak up a little?
So in your written testimony, it sounded like you referenced the University of Maryland a couple of times.
Correct.
But the bill is the University System of Maryland, which is actually 12 institutions and 3 historically black colleges and universities. Was it the intent that the University of Maryland, or is it actually the University System of Maryland?
It is the University System of Maryland.
Got you. Okay.
And I hope the committee understands we have that very close, warm relationship, the University System of Maryland and me. And, and that's why they're so anxious to do this, because we're like that.
I'm well aware of your very close relationship, but no, look forward to the results of this. Thank you so very much. Thank you, Madam.
Senator Hershey.
Thank you, Madam Chair. Senator, just in looking at the very beginning of this, asking the University of Maryland to conduct a study, relationship between the availability and price of homeowners insurance, emergency and disaster preparedness, and this other term I don't understand, climate change.
Is there a particular, where are you? So I'm trying to follow
the first
you.
part of the book, the first part of the bill. Section 1. I don't see that climate change is defined. Do you mean weather-related events?
I mean climate change.
So,
and I think climate change and the crisis that we are in, the midst that we are in, and the climate change is pretty well understood. And I don't think that that's ambiguous, but please.
No, I'm just wondering, I mean, you mentioned climate change. I've heard weather-related events. I think that they're very different. You're talking about a broad term that may mean different things to many people, but if you're asking for a study on this relationship of climate change, one would have to agree that these weather-related events are related to climate change or because of climate change, or?
For yes. Those of us out in the real world,
yeah.
Climate change is causing weather change and weather events and dramatic weather events that we have not historically experienced, but are happening with greater frequency and greater intensity. And that is a consequence of climate change.
Well, that's really disappointing because I know for, I guess, at least the past 20 years or so, we've taken all these policy steps to reduce climate change here in Maryland. So I guess we're saying they just haven't been very effective, are they?
I think what we're doing is our best as a state, a legislative body, and as the residents of this great state to do our part in trying to mitigate the harsh impacts of climate change. And unfortunately, we now have an administration that's in total denial and is putting us back into the fossil fuel stone age that created this climate crisis. So clearly, the policies of this federal administration will exacerbate what the experience we're having with climate change now, and clearly will work against the efforts of climate conscious states like Maryland, that where we recognize we are all sharing this planet together and we should not be destroying it for future generations. But that does seem to be lost on the current federal administration.
Yeah, that's interesting.
Happy to further engage on that conversation.
I think you've done a, talking about taking money from the CEF fund, which again shows that there's been failure in our policies on how to meet renewable energy goals. There's all kinds of money in there for this bill and all kinds of other
I wouldn't
budget
call that
maneuvers to
failure.
take
I
place.
call it, it's an ongoing work progress that takes dedication and time. We didn't get here overnight. We're not going to dig out from under it overnight.
All right. Well, thank you. I appreciate this legislation.
I love you.
I love you too. Thank you, Madam Chair.
We all love each other. Thank you. Do we have our virtual? Oh, sure, Senator Reedy.
I just am curious if I can ask.
Look, we got more love going around.
I think the ground on climate change has now been trod. I'm actually just curious, and Secretary Grant, maybe the question's for you, but happy to hear from anybody on the panel. Just one of you, though. What are we trying to get out of this? Because I'm reading this whole thing. I'm looking at the testimony. Why do we need a study that is going to cost money to tell us that if storms are indeed more intense? Of course, I always enjoy the comparison of they're more intense than they were 100 years ago, as if we were keeping the same records 100 years ago. But that's another issue for the time. What are we doing here? Like, what's the point? If we do believe climate change it sounds like a foregone conclusion. It's assumption. The assumption is climate change has made our insurance go up, and weather events certainly do make our insurance go up. We have more weather events. So I don't understand what the point of the study is. Like, what are we going to get out of it once the study tells us what we want to hear?
Let's not forget that the other part of the bill, taking the totality of the other areas, right? We know about the climate change, we know about the insurance. How are we as Maryland prepared in our industry of emergency management, which includes disaster mitigation, disaster preparedness, disaster response, disaster recovery, to meet those needs when we have a federal system that is ever changing? And so we really need to meet the needs of the residents.
Okay, so let me stop you there because I appreciate the answer.
Yeah.
What are we? Is it we think FEMA's going to go away, or we think that like NOAA is going to go away, or is it more like we don't know if what we're currently been doing on building up the floodplain and building standards that we've changed repeatedly in the state to try to become more resilient, we don't think that's good enough? I mean, is that what we're trying to analyze with this, or are those two different streams? Is that what you're saying we're trying to do?
So in terms of FEMA, the uncertainty of FEMA is certainly harming how the locals and the state prepare for disasters.
What's the uncertainty of FEMA?
So federal grant money that I haven't seen my FY25 grant money come in yet. That funds our programs, that funds our staffing. That has been the way for the last 2 decades.
You're
And so-
staffing in Anne Arundel County for
Yes.
your
And that's
your MEMA.
statewide. That's statewide. That's statewide. Locals depend on those federal grant monies in order to staff their programs, to have those core capabilities to respond and to help residents when a disaster occurs. And so the uncertainty of that and what's coming about, and especially even after this administration, we don't know what FEMA's going to look like. So let's take that uncertainty out of the picture and say, hey, state of Maryland, let's build up what we have in terms of the programs, in terms of the investment in mitigation, response, and recovery.
Okay, I buy that. I can understand that perspective, and I get why we want to get more into it. And protecting our citizens is, we all agree, is the role of government. So I get that. I guess my confusion is we also are throwing homeowners insurance in there. Like, why are we doing? Maybe Secretary
Yeah.
Grant, and then I will conclude, Madam Chair. Thank you.
Yeah.
Why are we doing that?
So I think what a lot of other states have done, Senator, and I think where I think we deserve to give it a good look is sort of that individual private sector. How are we all interacting to make sure that folks are adequately incentivized to make sure to fortify their homes, essentially, right? To make sure that they are doing the right things to protect their homes from damage in national disasters. I'm going to give you a couple of examples because it looks different in every state, and it's going to look different for Maryland. And it's probably going to look different in different parts of Maryland and how we might structure and think about all of that, which I think it's worth a study. But in California and some of our western states, that often looks at how do we make homes resistant to wildfires, because there are very basic things that you can do to help protect your homes from damage from wildfires.
Is your contention that this could help? The idea would be, the reason you're looking at this in the same context with emergency management is, hey, John Q. Public, your homeowner's insurance is rising, your costs are rising, but if you knew that you could do X and Y to your house.
Exactly.
Okay.
Exactly.
I'm still struggling with why we need this massive study to do some of those things, but I appreciate the answer.
And Senator Reedy, I will share with you that a big part of this is insurance pulling out of the state of Maryland on our coastal shorelines. Back when I was a member of Economic Matters Committee, I think it may have predated your time here, we had to deal with an emergency situation where insurance companies were pulling out of the Ocean City marketplace and a considerable number of areas in the state, and we had to take action to address that. And I think we are becoming more and more vulnerable to that kind of concern where suddenly homeowners find they don't have insurance coverage because companies have said, we're out of this marketplace, and yet they have mortgages that require they be insured. So I think this is all part of the goal here, is to get ahead of that instead of, because at that time we had fallen behind. So I love you. There's a lot of love in this room.
Well, there really is, but, thank you. Okay, I think that ends the hearing.
Thank you, Madam
Thank
Chair.
you. Thank you all very much. Next, we're going to go to Senate Bill 890, Senator Giles' bill on insurance premium receipts tax exemption for captive insurance procured by nonprofits.
Thank you. Pleasure. Thank you.
Oh, hello. Thanks so much.
Another rural voice down there.
Yeah, appreciate it. It's important. Thank you. Good afternoon, Madam Chair, Mr. Vice Chair, and members of the committee. For the record, Senator Dawn Guile, District 33, here to present Senate Bill 890. Senate Bill 890 was brought to my attention by the Maryland Hospital Association due to concerns regarding Maryland's premium receipts tax and how it is applied to nonprofit hospitals that use captive insurance structures. Hospitals sometimes create captive insurance entities to set aside their own funds to manage manage risk, particularly in areas where traditional commercial insurance is either unavailable or prohibitively expensive. These captives function as internal reserve mechanisms for future liability claims. MHA will provide some information in greater detail, including how the tax should be applied and certain statutory changes that would be appropriate. They also have some amendments that they've been working on with the MIA. We'll be submitting those as well with apologies. We didn't have some opportunity to review those before they've been submitted to the committee before the deadline for the hearing. Ultimately, there's just some concerns regarding the applicability of the tax to these nonprofit hospitals who, as we all know, have some concerns, especially as the AHEAD model is being implemented and some of the financial constraints. And we want to ensure that our Maryland hospitals continue to run and serve Marylanders. Ultimately, this is a complex and tax and insurance matter that involves nonprofit hospitals, MIA, and the interpretation of existing premium receipt tax provisions. And for that, I respectfully request a favorable report on Senate Bill 890. I have MHA and Matt here from UPMC Western Maryland, who will be giving some further information and details about this somewhat complex issue. So thank you.
Great. Thank you, Madam Chair and members of the committee. I'm Jake Whitaker, and on behalf of Maryland's hospitals, I'm here to support Senate Bill 890 with our proposed amendments. So with the proposed amendments, this bill establishes a reasonable framework to regulate and tax how hospitals self-insure currently. And so for some context, I wanted to provide a brief overview of captive insurance and why our hospitals use it. So Maryland hospitals have to insure serious and significant risks like medical malpractice or cyber liability. And oftentimes this insurance is either unaffordable or just simply unavailable in Maryland's commercial market. So nonprofit hospitals operate captives like a savings account or a rainy day fund, where hospitals basically set aside those funds to pay for legal claims against our hospitals. And I just want to be really clear, it's our own money that we're setting aside to pay for, example, future medical malpractice claims. And so currently there isn't a legal framework in Maryland to address this issue, and so that's why we're advancing this legislation today. And so I know some of you have heard from some opponents that some of these captives may look shady or nefarious because they're domiciled in the Cayman Islands. But when we set up these captives decades ago, there just wasn't the multitude of jurisdictions in the nation to be able to establish this framework and regulate it in the United States. I would also say that we do register these captives with the IRS, so this is not a secret by any means. Additionally, in our conversations with the MIA, our members were very clear on where these captives were domiciled, including in the Cayman Islands. And so these amendments today that we're proposing reflect our discussions with the MIA and how we see that these captives should be taxed. And I think we've come up with a fairly common sense approach. So what we're saying today is with our amendments is that when we're setting aside our own money, that money shouldn't be taxed. But when we take that money from the captive and actually purchase insurance, that's when we should be taxed for premium insurance taxes. So for the aforementioned reasons, we respectfully request a favorable report with our amendments. Thank you.
So, good afternoon. Good afternoon. For the record, Matt Gilmore with UPMC Western Maryland. I'm General Counsel for UPMC. We're here to speak in favor of Senate Bill 890. My colleague Jake Whitaker obviously speaks for the entire MHA. We are a proud member of MHA. I'm here only to talk about one hospital. But to understand our captive, I think you have to understand our hospital and what we're able to do. We are based in Cumberland, Maryland, a very rural section, as many of you know. We employ 2,100 folks. We have the only open heart program west of the Beltway. We deliver 900 babies a year. We have a neurosurgery program. We are a level 3 trauma center. And we take care of a very challenging and aged population. And why do I point this out is because the captive makes that possible for us. In the 20-plus years that UPMC Western Maryland has had a captive insurance company, we have saved in approximately $25 million as if we had to go out into the commercial market and buy that. And so those savings make all the difference. We cannot pass on that additional $25 million of costs onto the consumers. The senator mentioned, we're changing to the AHEAD model. There have been substantial cuts to Medicaid in this current administration. So these are real savings for us, and the captive, to demonize it, as some of the opposition would like to, because we're based in the Cayman Islands. Again, when we domiciled in the Cayman Islands 20 years ago, you could not domicile one in the state of Maryland. You still cannot structurally put one there. We picked the Cayman Islands because it is the leading domicile in the world for captive insurance companies for not-for-profit hospitals. It is extraordinarily regulated. Again, we file with the IRS. It has regulations from the British Commonwealth. There's no hiding the ball here. It's easy to demonize it from a name, but the details don't support that. Thank you.
Thank you. Do I have some questions? Let's start with you, Senator Mounts.
Thank you, Madam Chair. Jake, what are the amendments? What do they do to the bill, and what is the intent of the amendments?
Yeah, so we had a couple of drafting errors when we got the draft back from DLS, which just basically exempted the hospital captives from a tax completely. So you'll probably recognize in the fiscal note that there is a decrease in state revenue, but these amendments clarify that we're actually paying the tax. So there will be a positive revenue for the state. So we're actually paying taxes, and it's going to increase the revenue.
I had a bill earlier where there was changes. So what do the amendments do, though? How does that work? Can you explain it?
Yeah, so currently the bill basically just exempts our nonprofit captives from the unauthorized insurers premium receipts tax. What these amendments do is basically put us back in the purview of Maryland law and basically makes it so that we're not taxed when we move our own money into our own captive, but we're taxed when we take money out of that captive and actually purchase insurance. And we think that's in line with what the unauthorized insurance tax was meant to do in the first place, which was basically tax companies when they purchase insurance from outside of the state that isn't regulated. So we feel like we're kind of achieving that intent here.
Okay, thank you.
Thanks. I was looking through the testimony, and I'm glad that the amendments, I think, help it a little, because just exempting completely, which sounds like it wasn't your intent, would have been a little bit troubling, probably.
That's correct.
Problematic, yeah. So now you'd be paying, what is it, a 1%?
It'd be a 3%, just like the current 3% tax for
But
unauthorized
only when you move the money from the captive into buying insurance.
Yeah, so essentially when we put the money in a captive, we're putting it in a savings account or a rainy day fund to cover those liability costs. We're saying when we actually purchase insurance, which is what the statute was intended to do, that's when we pay the tax.
So, because it looks like there's hospital assets of like, I don't know, like $3 billion offshore. And I understand the explanation of why it went offshore in the past. And does it still have to be offshored, or is there no product onshore anymore that you can that you can utilize?
Thank you, Senator. Matt and I talked about this, and if okay with you, if he can answer this one, please.
So thank you, Senator. So when we set it up in the Cayman Islands. It's been very successful there. Again, we have accounting of the monies that the captive holds and how it controls it. But there would be spending thousands, if not hundreds of thousands of dollars to then set up an entity that's already successful to move it. And it doesn't change the tax liability. Okay, we're a not-for-profit hospital. I understand you see it as a for-profit entity, but there's no money that's being paid out to the hospital like as a windfall bonus to their general counsel. It says we take the money, and when it makes profits.
That's an oddly specific example. No,
yeah, trust me, I wish that was the case, but it does not work that way. But when we quote unquote make profits, that allows the captive, when it invests, to save us for premiums. Okay, but and so we save money. So this money is quote unquote offshore. It's not avoiding taxes. There is
well,
no
but let's be clear, it was avoiding taxes.
Well, actually, when it was set up, okay, it was still, we are a not-for-profit entity putting money there. And so as it grows, okay, the captive insurance grows. That's the idea. It makes investments. That's why it's a for-profit entity. But
because it makes investments.
It's making investments. Okay. But the money isn't paid out as a dividend to anybody other than to UPMC Western Maryland Corporation or the respective hospitals But we then, as a not-for-profit, we don't give that out as dividends to shareholders. We take that like we do when anytime our profits exceed our costs, and we plow it back into our entity. That's how we build a new hospital in Cumberland, Maryland, in an economically depressed area, because it's being sound with our money, responsible with it. So there is no windfall.
I appreciate that's
Yes.
really helpful. And I'm all for the investment idea, and I get the concept. I mean, I'm just like, we've said it, is these for-profit captive entities. For-profit, believe me, I don't believe that is a dirty word at all, other than you all are nonprofits. But I understand what's going on. But like, just reading some of the testimony, there's a whistleblower testimony. I mean, it's like there are, executives who came in once a year and meet down there. It's required by their charter, and it's just a lot of kind of odd stuff that it's like it was operating outside of the law in Maryland, or it was evading this. So is this bill now still retroactive, or are we going to have tax payments for what wasn't paid properly in the past with this, or are we exempting the hospitals from any tax? Or not, well, it's not the hospitals, but these entities from tax from before?
Yeah, and so I just want to clarify, Senator, the position of the hospitals is that we've never been subject to this tax. We view it as our money that we're just moving from one bucket to another.
So you're just trying to
we're not
clarify
purchasing
that in
insurance.
law.
So we're just trying to clarify that, but we're saying when we actually do purchase insurance, you should tax us. And so that's what we're offering here today.
Okay, but you haven't been taxed before when you purchase insurance.
I can't speak to that now.
Oh, okay, that's fine. I'm just looking through the testimony. There's like some MIA cases and stuff. So I'm just trying to be sure I understand where we are in that process. What we don't like to do in the General Assembly, at least my experience has been, I'm very sympathetic. I think we want to straighten the law out for sure. We just generally don't try to go back in time, and retroactivity is always a little bit of a challenge. Just being sure we're not setting I'm basically just concerned about setting a precedent where we go back in time and fix something retroactively, and then other folks will come in and say when something else happens.
Yep.
I don't know if you can respond to that.
Yeah, no, so our position was there was never a framework for this type of captive organization in Maryland. So that's what we're creating today, to be able to tax those reinsurance premium purchases.
And it wasn't illegal for you to create them because they are legal entities where you created them.
Absolutely.
Okay, all right. Thank you. Thank you, Madam Chair.
Thank you, Madam Chair. Jake, just to continue on that. So you said that there was never a framework for this. And what has caused the position of MHA to say that this legislation then is now necessary?
Sure. So the MIA did initiate an inquiry to determine whether or not we should be subject to the original tax. To their credit, we've had a lot of good discussions with the MIA, and we've been able to come up with a framework that I think kind of achieves that balance where we appropriately regulate the captives. Because under the current law, we'd basically be punishing ourselves or taxing us for moving our money from our checking to our savings account. So a lot of credit goes to the MIA for sitting down at the table to work with us and really figure out a framework that appropriately taxes these entities.
So I saw MIA has a letter of information. Are they suggesting that legislation is the appropriate avenue to fix this problem?
I don't want to speak for the MIA, but we've had ongoing discussions, and the language we submitted as amendments reflects those discussions on how this tax should apply.
For what it's worth, Senator, we spoke with MIA, and they've maintaining a neutral position and have indicated, at least to me, that it's a policy decision as to what we decide to do. So
Yeah, I appreciate that. That
Yeah.
just puts us in a very tough position. as
Understood.
Not being the experts to try to figure out if this really is a policy decision, or is this something that MIA should handle? Again, and I go back to Senator Reedy's, if this is retroactive or not, I would think even the comptroller might want to weigh in to, is this, foregone taxes that were not collected if you guys misread this or didn't handle this correctly? Is there a potential that that could be a situation that we're in?
Well, so I think the way the bill's written, the tax would only apply prospectively. But with the current unauthorized insurance premium receipts tax, we as a hospital field don't believe that it applies to us. So we don't think we're getting out of it.
You might not believe that you should pay that. A lot of us don't believe we should pay a whole lot of extra taxes. But the reality is, if you were obligated to do that, and then you just had your attorney's position is that they said, hey, this doesn't apply to us, so therefore you go down the road and say it doesn't apply to us, and now are you potentially in a position where somebody is saying, hey, it really does apply, and now you are responsible for not having, interpreted the law the way that, the insurance administration or the comptroller might interpret it?
As far as I know, the state hasn't made a determination on whether or not the existing tax applies to these captive organizations. We're just trying to say, let's move away from that framework and just move forward with this prospective tax on the reinsurance premiums. I think the reason for the retroactive language is so that there isn't future interpretations where they would say, hey, you moving your money from your checking account to your savings account is actually a purchase of an insurance premium. So I think we're just establishing kind of a permanent framework so we don't have to continue to have these policy discussions in the future.
Understand. Okay, I think it'd be interesting to get a little bit deeper perspective from MIA and maybe the comptroller as well too, but fully understand what you're trying to do. Thank you. Thank you, Madam Chair.
I don't see any other questions for this panel. That ends the hearing on Senate Bill 890. Thank you. We are now going to Senator Washington's bill, Senate Bill 866. Senator Washington, you want to bring up Laura Hale,
Yes,
Patrice Bullock, and Deanna Nara.
thank you very much.
Thank you.
Thank you, Madam Chair, members of the committee. For the record, Senator Alonzo Washington here to present on Senate Bill 866. I respectfully submit this bill in support of this, bill and testimony in support of this bill. This legislation ensures that Marylanders have clear information so they can make informed choices and protect their health. Excessive sodium and added sugar consumption is a serious public health concern. According to the 2015 Maryland Behavioral Risk Factor Surveillance System, an estimated 1.5 million adults in Maryland have hypertension, and nearly 700,000 do not have it under control. Among Marylanders 75 and older, over 70% of them report having high blood pressure. This is a preventable crisis. Nationally, 90% of adults consume too much sodium, about 900 milligrams above the recommended limits each day, primarily from restaurants and processed foods. Americans also consume an average of 17 teaspoons of added sugar daily. Again, that's 17 teaspoons of added sugar daily, far exceeding recommendations. Many consumers do not realize how much sodium and added sugar are in the food they order. This bill will require chain restaurants to display a clear warning icon next to menu items that exceed 50% of the daily consumption allowance of sodium or added sugar. It also requires the Maryland Department of Health to conduct a public education campaign on this topic. The bill does not restrict choice or ban foods. It simply provides transparency of how much sodium we are consuming as Marylanders. Evidence shows this approach works. After New York City implemented sodium warning icons in 2015, a 2025 peer-reviewed study found declining hypertension rates, particularly among women and Black residents. The bill promotes informed dining, reduces preventable disease, and strengthens transparency. I respectfully urge a favorable report on Senate Bill 866. Thank you.
Good afternoon, Madam Chair and honorable members of the committee. My name is Laura Hale. I'm the Director of Government Relations with the American Heart Association, and we stand in strong support of this legislation. The Informed Dining Act gives people something simple but powerful, the right to know what you're actually consuming. On a personal note, my grandfather suffered from kidney disease, and as part of that, he had to very much watch how much sodium he was consuming. My grandmother ended up having to cook almost every single meal towards the end of his life in order to do that, because it was so difficult for them to dig through the menus online of those PDFs, trying to find what would be a safe item, or even something like grilled chicken might be so soaked in salt it would not have been safe for him to consume. With icons like these, my grandparents and others could have gone to a restaurant and my grandmother wouldn't have to cook all the time. It would have made such a difference for her. Also, as we look to looking through as well, we noted the Department of Health's letter of information and dug through that a bit. We think that the study that we've put into the legislation is not necessary. We have plenty of studies that demonstrate how wonderful this bill is. And you know, if I'm sitting here, that we've got a very strong body of research of why this is, and I'm happy to give you all those pieces. We also think that for the Department of Health's here, we can work with New York City to implement what has been done in terms of the ICON and other regulatory guidelines to make their lives easier, and we have reached out to be in conversation with them later this week to hopefully get that together. The other thing, just to note for you all, in the bill, we found a small typo for added sugars. It says milligrams, it should say grams, and we will make sure to get that sorted. Happy to answer any questions. Thank you.
Good afternoon, Chair, Vice Chair, and honorable members of the Finance Committee. My name is Patrice Bullock, and I am a nurse practitioner and community health advocate, and I speak in strong support of S-Bill 866. Every day in my work, I care for patients managing high blood pressure, heart disease, diabetes, and other chronic conditions that are deeply affected by the food we eat. One of the most common things I hear from patients is, "I didn't know." They didn't know the dish they ordered at a chain restaurant had more sodium than an entire day's limit. They didn't know the item they thought was a healthy choice was actually packed with added sugar. And they didn't know how much these hidden ingredients were contributing to their health challenges. The Informed Dining Act would change that, not by restricting what restaurants can serve, but by providing clear labeling and on any menu item that contains more than 50% of the recommended daily intake of sodium or added sugars. It's transparency, not regulation, and it's information people have a right to. As a clinician, I can tell you that sodium and added sugars are two of the biggest dietary drivers of hypertension, heart disease, and diabetes. These conditions disproportionately affect older adults, low-income families, and communities of color. Many rely on chain restaurants for convenience, affordability, or lack of options, and they deserve to know what they're consuming. This legislation empowers individuals to make informed choices. It helps parents protect their children. It supports those trying to manage chronic disease, and it gives healthcare providers like me a stronger foundation to help our patients succeed. We're not asking restaurants to change their recipes. We're simply asking for honesty and transparency. Thank you for your time and consideration for this important legislation.
Deanna?
Good afternoon, Madam Chair and members of the committee. My name is Dr. Deanna Nera, and I am a licensed nutritionist and campaign manager with Center for Science in the Public Interest, a consumer advocacy organization that has worked more than 50 years to improve public health through better nutrition and safer food. And I respectfully urge a favorable report on SB 866, also known as the Informed Dining Act. And so here's what this bill is really about. The Smoothie King Cocoa Pitaya Smoothie Bowl contains 71 grams of added sugar. The recommended daily limit is about 50 grams, so I want to realistically show you all what that looks like. Senator Washington, can you catch this for me? Okay, we're going to look at how much sugar is actually in here in packets. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. We're going to pause there because that's your daily recommended limit. 13, 14, 15, 16, 17. 17 packets of added sugar, or 17 grams of added sugar. 71 grams of added sugar, 17 sugar packets, is what is in a single menu item that most people think is very healthy. This is not unusual. This is a common occurrence in chain restaurant meals and menu items. We know that average fast food combination meals exceed 2,110 milligrams of sodium and 68 grams of sugar. We know also in Maryland that more than 1 in 3 adults has hypertension and more than 1 in 8, about 1 in 8 has diabetes. These are preventable, diet-related conditions that strain families and our healthcare system. More than 70% of the sodium consumed in the US comes from packaged and restaurant foods. And we know that, again, consumers are regularly underestimating this. Calorie labeling alone does not tell this story, and restaurants already calculate this information. Major brands, including McDonald's, Taco Bell, KFC, and Dunkin', are already publishing added sugars and sodium. This simply ensures that when these menu items have more than a half a day's worth of these recommended nutrients, that the fact is clearly visible at the point of purchase, and Marylanders deserve to see very clearly what they're eating. And we are in strong support for those reasons.
Thank you. Do I have any questions for this panel? Okay, I don't see. Thank you. Sorry.
I do not want these.
I don't see Mr. Thompson. Oh, there he is. You didn't hear me. I'm sorry. Couldn't see you over in that corner.
Thank you, Madam Chair. Members of the committee, I'm Melvin Thompson. I represent the Restaurant Association of Maryland, and we do oppose this legislation, and I apologize that this is a new issue for us. We're still receiving feedback, Senator Washington, so I haven't had a chance to come talk to you about it, but we're certainly willing to talk to the sponsor and to the other stakeholders, as I mentioned at the House hearing yesterday, about our concerns. But chain restaurants are already required to provide calories on the menu and other nutrition information per the federal menu labeling law. And so that information also already includes information about sodium and total sugars. But we're concerned that state-specific sodium and sugar requirements for this warning icon proposal would create an nationwide uniform patchwork of requirements that would be inconsistent standards and potentially confuse customers regarding nutrition messages that differ by state. With regard to added sugars in particular, unlike packaged foods, federal menu labeling rules do not require chain restaurants to disclose added sugars. Only total sugars are required. Calculating added sugars is a little more complex and requires ingredient-level data and constant updating. Added sugar is also more difficult to calculate and maintain accurately in restaurants than for packaged foods. And I'll note that the New York City requirement for added sugars applies only to prepackaged foods or equivalent non-packaged items that are presented the same way as packaged foods, things like fountain sodas or salad dressing, for example. And I think it's important to also mention that the health benefits of this legislation are unclear, and I will draw your attention to a letter of info that was submitted by the Department of Health, where they say the overall impact on consistent behavior change and product reformulation has been limited and mixed. Data from New York showed that there was a small decline in the proportion of consumers selecting high sodium items and little evidence of widespread industry reformulation, suggesting that awareness-based strategies alone may not reliably produce sustained behavioral or structural changes. And for those reasons, we oppose this bill and request an unfavorable report. Thank you very much.
Thank you. Do I have any questions for Mr. Thompson? Senator Mounts.
Thank you for your testimony. So you were referencing, were the other locations where local jurisdictions had implemented the requirement?
For warning icon, that's in New York City and also in Philadelphia. For sodium in New York City and Philadelphia, in New York City it's been in effect since 2015, but it was only in 2025 that they added the requirement for added sugars, but again, that only applies to prepackaged foods or non-packaged foods that are presented in the same manner. It does not apply to made-to-order items, entrees, salads, sandwiches that you would order from a restaurant menu. So I just wanted to make that clarification regarding the added sugars requirement in New York City.
Which this bill covers.
This bill would require warning icons on both sodium, high sodium content per the threshold established in the bill, and also high added sugars. And the FDA has not produced any guidance for how to calculate added sugars for things that are not prepackaged foods. Those added sugars requirements right now per FDA are only on packaged foods. So New York City, when they developed their regulations, they made the disclosure for added sugars sugars, my understanding is contingent on FDA releasing some guidelines for nutritional labeling that addresses added sugar for chain restaurants. It does not apply to things that are not prepackaged or non-packaged presented in the same manner.
Well, thank you for explaining.
Certainly.
Thank you, Madam Chair. So for chain restaurants, they make the same dishes. Is that correct?
What do you mean by same dishes?
Like the same foods.
Oh, yes. And the way that a chain restaurant is defined in the bill is the same as it's defined in the federal menu labeling requirements. An establishment that has 20 or more locations operating under the same name and making for sale essentially the same menu items.
Right. So they would be more likely to be able to have those, whatever the sodium is, the sugars and things of that nature. They would already have that information then, I would assume.
And let me clarify, Senator, it's a very good question. And that is why they already provide the full comprehensive nutrition information as part of the federal menu labeling law, which requires the disclosure of calories on the menu and other nutritional information that includes sodium. It includes sodium and it includes total sugars. And customers can request that information. It's available on websites. But what this legislation would require is warning icons that would be required if a food item on the menu exceeds the values that are established in the bill.
So you would have to go to a website to find that information?
For calories on the menu, you would see the calories listed in the chain restaurant right next to the menu item.
Okay.
But for the other nutrition information that's required under the federal menu labeling law and regulations, you ask for that information, which is disclosed upon request. Now, in practice, most restaurants have that available on their websites. You'll see sometimes a QR code on the menu that refers to that information. And so it is available, but it's available with all the other nutrition information that they're disclosing regarding their menu items.
So if it was posted somewhere in the restaurant, would that be helpful for you?
I'm sorry, sir, if what was posted?
The nutrition, like the sodium and all of that, instead of having to go to a website, what if it was somewhere where the customers could at least see it easily?
Yeah, and there are some restaurants that may have pamphlets or brochures that they provide that information, but most people have devices now, mobile devices, and that's why a lot of the information that is disclosed is available through a QR code that customers can scan and get that information as well.
So what is your opposition to, if they already have that information, like what is the opposition?
So what this requires is the warning icon for any menu item that exceeds the specified limits for sodium or sugar, added sugars. And the issue that we have with that is that you're putting this designation on the menu item. And when it comes to things like appetizers or desserts or side dishes, a lot of those items are made to be shared. And so the actual consumption of the sodium is not going to be the same as would be disclosed in the warning label that this bill would require. So that's one of the concerns that we have with this proposal. The other thing is that restaurants would be required, the way the bill is drafted, to update their menus, to put these warning icons on printed menus, any place that the consumer uses the menu from which to place the order. So that would be online menus,
Right.
that would be...
But that would be a one-time
But
expense, I guess, right?
but it requires updating. You would have to keep that information updated. So as your ingredients may change from a supplier, that information would have to change as well, and you would have to update the menus across the board with these warning icons for both sodium and sugar. And so that would be an expense. But the real issue that we have is this would be a burden on the restaurants to designate these items with the warning icons and keep that information updated. But as was suggested through the data from New York and was mentioned in the Maryland Department of Health letter of info, we don't know if there's a real quantifiable public health benefit or sustained change in consumer behavior as a result of what would be required in this bill. If there are other ways that we can educate the customers about nutritional things, I'll be happy to work with the sponsor and the stakeholders on this issue, but that is also a major concern for our industry.
Thank you.
Washington?
Thank you, Madam Chair. Just on your, thank you for being here and thank you for that last statement because it intrigues me that you're saying that if somebody visited a restaurant, they saw this, it wouldn't deter them based on how much sugar or sodium is in a certain item to choose another item?
No, I'm saying that the data that we have seen so far from New York has not shown that there has been consistent change in consumer behavior based on the disclosure of the warning icons for sodium on their menus in New York. We haven't seen data yet on sugar because that requirement for added sugar just took effect in October of 2025. The data that we saw, and I believe is referenced in the Maryland Department of Health letter of info, is regarding the sodium requirement.
Right now, a lot of restaurants, they identify the number of calories. Has there been studies done to show that when folks see the number of calories in a certain dish, that they then are deterred from ordering a certain dish from another dish?
I have no data to present today. I'll be happy to research that, but I don't have that information here today regarding the change in behavior as a result of posting calories on the menu.
But it changes the behavior of a lot of my friends. So I'm gonna use that study as one, because I've seen it where folks see the number of calories in a certain menu, and then they change their behavior habits because they be able to see. I know folks go to the stores all the time and look at the sodium content of those packaged ingredients and say, hey, this is probably too much for me for my daily consumption. Let me try something different. And so we're trying to help. I think what this bill is intending to do is trying to change behavior and inform the public. And I think if you already have some of this information available, it'll be good if the restaurants were able to just identify that and show it. What is the hassle to be able to just identify if it's over 50%? Or if it's over 50% of the consumption for that daily use, how much would that cost? Can you quantify how much that will cost a restaurant to be able to just identify what that is and place it on a menu?
Well, there was testimony. I had a restaurant operator with me yesterday in the House hearing, and he testified that each change to his menu costs about $4.50, and they usually distribute about 1,000 menus when they make a change. And so that's the actual cost of updating a menu, but that varies depending on the type of restaurant.
And there's QR codes and digital, menus as well, right?
That is correct.
Got it. Okay. Thank you very much.
That ends. Okay, turn your light out. Okay, thank you. That ends the hearing on this bill, and we're going to move on to Senate Bill 626.
Thank you.
Thank you.
Senate Bill 626, certificates of birth, licenses, and identification cards, sex designation. We'll hear from Senator Lamb. On your panel, you have Charlotte Hoffman and Meg Sullivan. Okay, the other one is favorable with amendments. You may begin.
All right. Thank you, Mr. Vice Chair, members of the Senate Finance Committee. For the record, Clarence Lamb, Senator District 12, here to present Senate Bill 626 on the Birth Certificate Modernization Act. So this is a fairly straightforward bill that we actually did hear in committee last year. This bill makes three main changes in how Marylanders may update their birth certificate or birth certificate of their child. First, the bill requires the Maryland Department of Health to update a parent's name on a birth certificate if the parent receives a court-issued name change order. Currently, there's only a process to update the name of an individual on their own birth certificate. There are a variety of reasons why it is important that a parent's name or a child's birth certificate may be accurate, including for school enrollment. In addition to name changes related to gender transition, this change would also ensure that people who change their name to escape domestic violence are able to update their child's birth certificate. Even following marriage, it is currently unclear how to update a parent's name on a child's birth certificate. The second primary change that this bill makes is streamlining the process of changing the sex designation on a birth certificate. Currently, in order to change the designation on a birth certificate, an individual must be undergoing gender-affirming treatment. This unnecessarily inserts the state into decisions on when medical intervention is appropriate for gender transition. Additionally, it creates extra barriers for uninsured individuals seeking to update their documents. Under the bill, an individual would swear under penalty of perjury that the requested update was correct. 14 states currently already allow birth certificates to be updated based on self-attestations, and Maryland institutions accept those out-of-state certificates without issue. Lastly, this bill adds a third sex marker that can be selected for reissued birth certificates. We currently allow for an X marker on driver's licenses in Maryland, and until very recently, the federal government allowed an X marker on passports as well. Thankfully, passports last 10 years, so many people will get to carry their X marker passport well past the current administration. The ability to select an X marker will ensure that Marylanders have uniformity across their documentation. In addition to supporting transgender Marylanders, this option would be helpful for Marylanders living with intersex conditions whose physician at birth assigned them male or female, but as they grew up, they learned that they had an intersex medical condition. Since last year, there have been several federal incidents that have given a new urgency to passing this bill this session. The most prominent is that the Supreme Court permitted the current administration to end the ability of citizens to self-select sex markers on their passports. Prior to this change, many trans Marylanders used passports as an employment document because it was one of the only acceptable employment identification documents that did not risk outing them as trans. Under the new passport rules, more trans Marylanders will have to use documents with conflicting sex markers, which will put them at an increased risk for discrimination. A second issue that was highlighted by ICE's arrest of Diaz Morales, a U.S. citizen who was born in Laurel Hospital here in the state of Maryland. Ms. Morales was arrested by ICE in December and quickly whisked away to Louisiana in order to make it more difficult for the U.S. District Court of Maryland to intervene in her case. She was detained for 25 days and still fighting the federal government's attempts to deport her. Based on reporting around this case, it appears that the dispute boils down to inconsistencies in how Ms. Morales' identity documents listed her hyphenated last name. In the past, it was often easier to potentially write off inconsistent documents just as an inconvenience, but we have obviously entered a period where inconsistent identity documents or identity documents that didn't match a person's gender presentation could make it harder to contest unlawful federal detention or wrongful deportation. The recent federal issue is the House of Representatives. The final recent federal issue is the House of Representatives passing the SAVE Act. If the SAVE Act becomes law, a birth certificate will become an important voter registration document. This is especially true for individuals without a passport or driver's license. I'm positive that there are differing opinions on the committee about whether the SAVE Act is a good idea, but I suspect that we all agree that no one should be unable to vote because they can't fix issues with their birth certificate. In addition to ensuring that trans Marylanders have the documents needed to vote, this bill would also help ensure the names of cis women and their mothers, ensure that they're accurate on birth certificates following marriage, divorce, or other name changes. Overall, this bill is solely streamlining the processes so that all Marylanders can have access to legal documents that are consistent and accurately identify them. I want to reiterate that many Marylanders are already able to do what this bill calls for if they were born in New York, Mexico, Nevada, and one of 11 other states. This bill would allow those Marylanders who were born here in Maryland the same right. With that, let me close, request a favorable report of this committee once again, and turn it over to the other two members of my panel, Dr. Meg Sullivan from the Maryland Department of Health and also C.P. Hoffman.
Thank you, Senator Lamb. And good afternoon, Vice Chair Hayes and members of the committee. For the record, I am Dr. Meg Sullivan, and I serve as the Deputy Secretary for Public Health Services at the Maryland Department of Health. And I first want to thank you for the opportunity to speak today to express the department's support for the Birth Certificate Modernization Act. This bill represents the opportunity for the department to take vital steps towards ensuring Maryland's records accurately reflect the lives of those we serve. The department supports the intent of Senate Bill 626 as we recognize that certain statutory requirements are no longer aligned with best practices related to gender identity. This isn't a new direction for us. Since 2021, the department has successfully used gender-neutral designations like Parent 1 and Parent 2 on all Maryland birth certificates. Modernizing these processes further will reduce the documentation burden on Marylanders while maintaining the high standards required for vital records. The department recognizes the importance of the birth certificate as an identity document across many different uses and the importance of consistency across all these documents. We believe Senate Bill 626 makes our state records more inclusive and dignified for all Marylanders, and we respectfully request a favorable vote on this bill. And I'll now turn it over to the next panelist. Yes, please, sorry.
Mr. Vice Chair, members of the committee, thank you. My name is Charlotte Persephone Hoffman, and I am the Policy Director with Trans Maryland. My pronouns are they and she. And I am a proud trans person who is a parent. So this affects me in multiple ways. So I want to hit on a few issues that we haven't talked about so far. One is the issue of traveling as a parent who has a different name on your ID than is on your kid's birth certificate, especially when you're traveling internationally. Like, it can raise red flags with immigration in various countries, including when you come back in, because there's been so much concern, rightly so in many cases, about trafficking, that if they're like, oh wait, what are you actually this person's parent, etc. Having a birth certificate that connects you concretely to your own child makes that so much easier. Second, I want to talk about how this has become all the more important because of the sustained attacks that we're seeing from the federal government on providers of transition-related care. Over the past year, there have been multiple executive orders, draft rules from the Department of Health and Human Services, memos from the Secretary of Health and Human Services, et cetera, all targeted at pushing providers out of this space. And what that means is that there are fewer and fewer providers able to fill out the paperwork to say that someone is undergoing transition-related care. And there's fewer and fewer providers for someone to go to for transition-related care in the first place. And those few providers that remain in their market, more and more of their time is spent filling out paperwork instead of helping patients. So this is really a bill that is not just going to ease the lives of trans Marylanders and other Marylanders who've changed their names for any reason. It's also going to reduce stress on our medical system. Thank you.
Excellent. Thank you for your testimony. Are there any questions of this panel? Seeing none, thank you so very much. Next, we will hear from Pamela Tenna-Muzza. Pamela.
I think that was an accidental sign.
Oh, that was, okay, excellent. Thank you so very much. So no one else signed up. This ends the bill hearing on Senate Bill 626. Next, we will hear Senate Bill 179, sponsored by Senator Benson. Transportation Study of Speed Limits, Interstate 495, and Connected Highways. Do you have someone else joining you on your panel, Omar?
Yep.
Excellent. As always, the bill sponsor may take as much time as you need, and all others testifying will have 2 minutes.
All right. Good afternoon, Chair Senator Pamela Bidle and Vice Chair Senator Antonio Hayes and the esteemed members of the Finance Committee. My name is Oluwatosin Afolabi, and S. Bill 179 addresses a critical traffic safety and congestion concern affecting motorists who travel on Interstate 495 and the highways that connect to it. As one of the most heavily traveled corridors in our state, I-495 presents a unique safety and travel flow challenge, particularly at connection points where speed limits may change abruptly. SB 179 requires the Department of Transportation to conduct a comprehensive study on the implications of the speed limit changes on the highways in the state that connect to Interstate 495. The study will identify all highways that connect to to I-495 and examine the existing speed limits at those connection points. It will analyze traffic congestion, the prevalence of speeding citations, the number of accidents and other hazards and incidents over the past 5 years at those locations. Additionally, the Department of Transportation will evaluate the feasibility of requiring speed limits to deviate by only 5 miles per hour at the location where a highway connects to Interstate 495. If such adjustments are deemed feasible, the department will recommend appropriate measures to implement that standard. In conducting the study, the department will consult with local officials and stakeholders who expertise and familiarity with the traffic safety issues affecting these corridors. The findings and recommendations will be reported to the governor and the General Assembly by December 31st, 2026. This legislation does not mandate any immediate change in speed limits. Rather, it ensures that we base any potential adjustments on careful data analysis, safety considerations, and informed consultation. By studying congestion patterns, accident data, and enforcement trends, we can determine whether more consistent speeding transitions would enhance safety and improve traffic flow. SB 179 represents a thoughtful, data-driven approach to addressing roadway safety and congestion on one of Maryland's most vital transportation arteries. Thus, I respectfully urge a favorable report on Senate Bill 179, and thank you for your consideration.
Thank you. Good afternoon, Vice Chair and members of the committee. My name is Omar Masood. I'm the Director of State Government Relations for Advocates for Highway and Auto Safety, Alliance of Consumer, Medical, Public Health, Law Enforcement, safety groups, insurance companies, and agents working to improve roadway safety. I appreciate the opportunity to testify in support of Senate Bill 179. In 2024, there were overall estimated 579 traffic fatalities in Maryland, which is an 11% increase since 2015. And traffic fatalities remain higher than pre-pandemic levels. Speeding is a major contributor to traffic fatalities, as 30% of the fatalities in 2023 involved speeding, and speeding-related fatalities increased 40% from 2014 to 2023. In addition to the significant physical and emotional toll on Maryland families, motor vehicle crashes cost nearly $6 billion annually, according to a 2019 analysis. This is essentially a crash tax of $977 on each Marylander. When updated for inflation alone, in 2026, costs would equate to approximately $7.6 billion. Traffic safety is a serious and costly issue in urgent need of solutions. SB 179 would require MDOT to do a study of speed limits and other traffic safety metrics, including crash rates and the prevalence of speeding tickets on highways connecting to I-495. The study would enable MDOT to make data-driven recommendations, not a policy based on assumptions or past practices when it comes to making critical safety improvements. In conclusion, we commend Maryland for being one of only 5 states to receive a green rating in our annual Roadmap to Safety report, which rates states on advancing solutions to leading crash contributors. Yet, more needs to be done as we work to get traffic fatalities down to the only acceptable number, 0. We urge a favorable vote. Thank you.
Thank you so very much for your testimony. Are there any questions for this panel? Seeing none, thank you so very much. This ends the hearing on Senate Bill 179. Next, we will hear Senate Bill 838 from Senator Reedy. Public Health, Cottage Food Business, and Home Bakeries. Looks like a sponsor-only panel.
So good. That's all we got.
Thank you.
Thank you, Mr. Vice Chair and members of the committee. Senator Reedy here to present to you Senate Bill 838, Public Health, Cottage Food Businesses, and Home Bakeries. I raised this issue last year, and I'm come back with the bill in a little bit different form. I've had constituents and really people from all over the state that have reached out to me regarding cottage foods. We worked in the House Health and Government Operations Committee, and this committee worked several years ago to establish it, and it was painstaking to establish a cottage food ability for there to be cottage foods in Maryland, expanding cottage foods. But if you add any, if you're somebody who wants to do cottage foods, but you want to add foods that require refrigeration or require a lot of what's in the baking side of the house, in cottage foods. In current law, they're labeled as potentially hazardous. And so with that comes obviously the concern about the health department has generally opposes wanting to expand this. But to really have a successful cottage food business, be able to do baked goods really would allow a lot more people to either grow as entrepreneurs or to enter the space to begin with. But the list of items that are in this category of baked goods or of potentially hazardous are things like fruit tarts, pumpkin pies, custards, and there's other types of baked products. And currently, to produce and sell these items, you're required to have a commercial kitchen that's licensed and inspected by the health department, which is a whole nother ball game if you're trying to just run a little small cottage food business in your house. Working out of a commercial kitchen or commissary kitchen can be quite expensive. There's charge for the use of the equipment. It's a huge disadvantage to people especially in our poorer, whether it's rural communities or urban communities. So this kind of arrangement to work out of a commercial or commissary kitchen would require a catering license, which can cost $400 to $1,000 depending on the county. You also typically have limited access to that facility. Baking at home eliminates a lot of these overhead costs. And we're talking about, in this bill, we're talking about businesses that make less than $50,000 a year. So it's limited. You can't, this is not for people who are running a full-on bakery or are trying to run a full-on bakery or a full-on business. This is somebody who's trying to supplement their income for sometimes it's young people, sometimes it's seniors, sometimes it's single parents that are trying to supplement their income. It runs the gamut. Ohio actually has a home bakery law. They require a $10 license, but we've taken language from Ohio to help build this bill. The law allows your home to be recognized as a bakery, allow you to prepare perishable baked goods for sale. A home bakery in Ohio is permitted to manufacture non-potentially hazardous bakery products, cookies, breads, brownies, cakes, and fruit pies. Those are considered non-potentially hazardous in Ohio. And then potentially hazardous bakery products such as cheesecake, cream pies, custard pies, pumpkin pies, etc., which do require refrigeration. So this bill would help set up the same kind of structure here, where for these very, very small operations, they would be able to have a have a home bakery. So the bill is rather large because it adds home bakery in several different parts of the code, along with cottage food industry, or along with cottage foods. And I can just tell you, if you reach out to people in your community, there are a lot of people who want to do more of this or who do this already, as far as what they're allowed to do legally, and they would love to be able to expand, grow, and have opportunity to do more of these kind of, again, they're called potentially hazardous, which everybody gets concerned about, but the bill requires a very robust labeling process and also a pathway for how people could report if there was a problem. So it's, I think it's a really common sense way to help grow industry and to grow allow people to have a small business that they can do a little bit better with. So, Mr. Vice Chair, that's the bill. The health department never wants to expand this stuff. They never want to do it. I think there's a path here that would really be helpful. We have a lot of folks who have reached out to me over the last couple of years as I've worked on this issue, that their frustration is there's even the department really, they follow the regulations so far to the letter of the law that they really try to shut down any sort of innovation on it. Well, I understand we need to follow the law closely, so that's why I want to make an adjustment here. So anyway, that's the bill, Mr. Vice Chair, and I appreciate your support for it. Happy to work and see if there's a way, if there's concerns about certain types of things, happy to see if we can get something done on this, even if it's not everything that I'm asking for in the bill. But I think it's an important thing. So thank you, Mr. Vice Chair. Happy to take any questions.
Thank you so very much for your testimony. Senator Mouse.
Thank you. Just a real quick question. Thank you for bringing the bill. What can you just home good bakery? Like, can you name some of the products for a home good bakery? Just trying to make sure I understand what.
Well, that's a good question because in Ohio,
brownies or
brownies you generally can already do, but this would be a home bakery for the Ohio law. You can manufacture non-potentially hazardous bakery products, cookies, breads, brownies, cakes, and fruit pies, which I think goes further than what we allow now. But then also things like cheesecakes, cream pies, custard pies, and pumpkin pies, which do require refrigeration. To be clear, this is not to exempt you from having to refrigerate those products if you're making them. It's saying you don't have to operate in a commercial kitchen if it's under $50,000 of income to the state. Yep.
Senator Lamb.
Thank you, Mr. Vice Chair. I think this bill had come forward last year, right? Was this?
We tried to make an adjustment to a little bit closer to the Ohio law. I'm not sure how much we were able to, but that's what we're trying to mirror it on.
Okay. I guess my concern is that, that there is a reason that a lot of these health regulations are in place, particularly for the cottage food industry, to make sure that, particularly if you're selling things to folks, that it doesn't adversely harm them with, foodborne pathogens and illnesses and the like. And so it's always trying to figure out how to strike that right balance. I think on one hand, you don't want to have to regulate the mom who's bringing, food at a Girl Scouts event, right? But on the other hand, if it's a little bit broader than that, there's always the concern that, when it comes to the cottage food industry, where do you strike that right balance with folks, right? And so, have you had any further conversations with, say, like the health department since, the bill from last year?
Well, we've submitted this bill to them. Their response has been the letter that you have in the testimony, and I read through it. I mean, they just frankly are like a no. They're just a flat out no. But they were a flat out no on cottage foods too. They started as a flat out no to expanding cottage foods. The problem is the way the health department, and I don't mean the whole global health department, but the way the people who are in this part of the law work, whether it's locals or at the state level, they really believe that it's their job, if anything could ever possibly go wrong, that they have to stop it, that we can't allow it. That's what they believe. And I believe and I know you're talking about the balance, and you're right, you have to strike a balance. But if we're labeling properly, and if there's a pathway to reporting a problem, there is a little bit of a understanding that people can make their own choices if they're given the right information. I also do believe if you're going to have a business that's making over $50,000 a year, and $50,000 is something that's been I think in some other areas, then that's a little bit of a different situation. And I'll also tell you, you mentioned the mom bringing stuff to the Girl Scout event. I can tell you, even in the area that's allowed right now, the department is ruthless in going. I had one lady from Baltimore that told me she had set up this whole business where she and her daughter would help people decorate cookies, and she was told you can't do a cookie decorating class with people because you're bringing icing, and theoretically icing needs to be refrigerated. So it's just stuff like that. It's like, can we try to get past some of this? And so that's the point of the bill. But I've read their letter. I mean, I understand what they've said.
Right. I mean, but don't you think there should be a higher standard for food that's being sold versus just potluck, kind of in that example? Like if folks are selling food, and there could be a thought that it should fall under a higher bar because you are, having a business in some ways, just like you should probably be paying your taxes if you're
well, I agree with that. Yeah, you should be paying the taxes.
So there's a different threshold by which, when you're selling something, you're therefore falling under, business taxes and those kinds of things. You should fall under some basic, protections for consumers too.
I understand the argument. I think when we're talking about a smaller scale operation, the reason scale comes into it is if you're mass producing things, then I get there's more of a standard for you're going to lose an element of quality control possibly. I think when you're talking about a little small operation, again, I think it should be robust, like there's labeling and all of that. I guess I'd say I'd err a little bit more on the buyer beware with proper labeling and notification. on those kind of things. I think you and I may just probably won't agree. And it sounds like maybe the health department won't. I guess I'm imploring us to look at ways. This came even more real to. I just had a meeting back in my district about a month ago with an agricultural group that I meet with sometimes. And there was a guy there and he talked about trying to do more. He said, everybody talks about ag tourism. But he's like, the cottage food stuff really is, and he had some other things along with this issue that were on top of that. But these are areas where we could make it a little easier to make a little bit of money in Maryland and be entrepreneurial, you know? And I just feel like we've got to, at some point, we can't protect everybody from everything all the time. I'm not being crass in the sense that obviously refrigerated things, I understand it's a little step up. It's a little step up in needing to be careful, but it just feels like we could find a way. Like I said, Ohio does this. I think some other states have, but Ohio had a unique model. I don't know. Doesn't really answer your question, but I'd really love for us to find a way to make it a little easier for working people who are trying to make a little bit of money on the side or do something with their family or whatever. Just make it a little bit easier. So.
Yeah. Okay. Thank you.
Thank you. I don't see any other questions. That ends the hearing. Thank you,
Madam
Senator. Is Senator McCray here?
Yes, ma'am.
Couldn't see you. Thank you, Senator McCray. You're going to do Senate Bill 606?
Yes, ma'am.
Maryland Easy Pass Commuter Fairness and Transparency.
Yep.
Madam Chair, members of the committee, for the record, Corey McCray, Senator for the 45th Legislative District here in reference to Senate Bill 606. I'm very respectful of folks' time, so typically what you'll find is when there is no real opposition, I typically run right through the bill. But this one right here is a little bit more sensitive to me because I think that it's a consumer bill in reference to what's going on over there at MDTA. And what you'll find is that they've already agreed to figure out like what needs to happen. But I believe that if you read the recitals, you'll see some of the challenges that I believe is going on at the agency. Madam Chair, when I think about MDTA and what we have with our Easy Pass, I look at it almost like a monopoly. It's only one space that you can use. You have to use MDTA. You don't get the luxury of picking and choosing a different vendor or a different company to be able to use. And then when I think about that monopoly, I think about I've never seen any type of business where you're charged $4, but the late fee and administrative fees stack up to over 200% from that standpoint. So when you look at $4 can end up costing you $24, I've never seen anything like that, and I do not think that that's what fairness is. Even if other folks do it, that does not mean that it's right. And then when I think about just in reference to something that I found out, when I think about like all those folks when we were doing COVID and you may have constant address changes. So that's not to say that I've lived at my house since 2009. So I know my address has been stable, but that's not for every family. And what happens is if those folks move, that then accumulation of these charges start to stack up and we cannot make sure, like how do they grieve is what I'm trying my best to say. Here's where my own experience comes in, Madam Chair. I couldn't realize why my Easy Pass bill started to accumulate over $100. And what I did was I then said, well, maybe I just need to get multiple fobs. So I went and got my multiple fobs, and then I think I was at like 140. So I said, man, I'm just not going through the Easy Pass that much. Like, what is going on? I had no clue. Zero clue that I was paying for something called unused tolls. So I was paying for something that I was not even using. So what happens is, and this is where I think that we have a responsibility. When you know about something, you have a responsibility to do something. Even this doesn't happen under the people under leadership right now or the board under leadership. But there was one part where these unused trips, you had to use a certain amount of trips in 60 days. They shrunk that down to 45. And that's when I believe it becomes more predatory than anything else. After figuring out that it was 45 days, and I said, you can't even go to work that many days throughout the week in order to try to get to this target. So why would you shrink the amount of days in order for you to hit this amount? I believe that the price should be the price. I don't think that we should use different vehicles to figure out how we can generate more resources out of individuals, especially Marylanders. So as I stated, a lot of the work that you'll see is in the recitals. And the last issue,
The last issue, Madam Chair, is when I think about when we went to 100% electronic tolling, I still represent communities where they may say called unbankable, like bank deserts. So there, I still have a small population of seniors or folks that may not have resources that still use cash. So everybody's not using the credit card. Everybody's not using Cash App or Venmo or things of that nature. They're still using cash. And we took away the ability for those folks to be able to pay and still may get jammed up in this process of $4 on top of $24. My resolution to this, I've talked to the executive director, and I just said, Mr. Executive Director, the onus isn't on the legislature to come up with solutions for us to figure out how do we respectfully treat Marylanders but your consumers. You need to come up with a subset of ideas. I believe that the 60 days is very, very complicated for somebody like me to deal with, shrinking it down to 45. And like, how do we work through these administrative fees? How do we work through folks that may utilize cash? Because you can't just say, hey, this is the way it is. This population still votes, they still pay taxes, and they still utilize that level of service. So that's all it is. I just wanted my day in court. I wanted my day before you to be able to say we have an issue, but the onus is back on the agency to come back to the legislature with viable solutions to be able to make sure they're servicing all of us and not some of us.
Senator, I'm looking at the letter of information. We got one of those lovely letters of information.
Yes, ma'am.
We'll review that and see how we can help.
I appreciate you. And
I had someone whose credit card changed, and she didn't realize that was the card on her Easy Pass. She got a $6,000 bill for going back and forth to work.
It's tough because I didn't realize. I was trying to figure it out, and I talked to my friends. I'm like, man, what I did was I didn't realize about the unused trips until I lowered my bill to 25. So you can have the denominations taken out of your account. I always did 75 because I was like, hey, it might come out in a month and a half. It might come out in 2 months. When that thing went from 25 and they took $40 out of my account, I knew something was off because I said I had triggered it at 25, and I said, why are they doing it? But we should be able to say it. And that's the other thing is like, these things shouldn't just come to your door one day and you look up and you got like a college tuition payment at your step. You know? So I just thank you for, like I said, let me just get it out my system because, and I think that the agency will get what they need, but they do need to hear from us to say, hey, we need to move in a better direction.
Thank you, sir. Didn't we have similar issues when you and I served in the transportation?
I was going to say you were my leader because you chaired motor transportation.
Yeah.
It's tough because they're quasi-agency, you know, so they have bondholders that they have to be responsible to. But I do believe that so these are issues that was there. It was exacerbated during COVID, and they still linger. Every once in a while, I get about 3 or 4 emails a month around Easy Pass and folks trying to navigate their system.
We'll try to get them to look at it. Senator Ellis, you have a question?
Yeah, thank you, Madam Chairman. Thank you. Senator McCray, really interesting issue. I have a technical question for you. When you talk about, you know, like say, for instance, charge for unused trips. So this is when you buy like a certain number of trips, you prepay for like a month. If you don't use it, they charge you anyway. Is that what that is?
So I didn't know this. I got a transponder. So everybody that has a transponder, you have a certain amount of trips that you have to use in a 45-day period. It used to be 60 days. The trips didn't change, but the number of days which you had to use it did change. And if you do not use it, that's why I said if you got 2 or 3 fobs, like you really problematic because it's like you just be running through Easy Pass just to make sure you use these trips. And it's like a system. So I wasn't aware. Back in the day, all of it was under one account. So like even if you had multiple fobs, it was under one account, and I always used my trips from that standpoint. So I never had unused trips. I think they said that it's a subset of folks. I think it might have been 10,000 people that still had these unused trips, and they're trying to better communicate of their system. But I don't think you should be charged for something that you don't use. I'm rarely charged. I don't know anything else in my day-to-day life where I'm charged for something that I do not use.
So you're telling me I should check my account?
I think we all should check our account.
Okay, thank you, Senator.
Thank you. I don't see any other questions. That ends the hearing. And now we're going to go to Senate Bill 637, Senator Jackson.
Good afternoon, Chair Bidle, Vice Chair Hayes, fellow members of the Senate Finance Committee. For the record, I am Senator Carl Jackson here to present Senate Bill 637, Maryland Automobile Insurance Fund Producer Minimum Commission Repeal. SB 637 addresses an important statutory provision within the Insurance Article 2512 that governs commissions paid by the Maryland Automobile Insurance Fund. The Maryland Automobile Insurance Fund, or Maryland Auto, is an independent agency of the state. It provides automobile liability insurance to Maryland residents who are unable to obtain insurance in the private market, thereby reducing the number of uninsured motorists in the state. Under current law, Maryland Auto is required to pay fund producers a commission of not less than 10% and not more than 15% on private passenger automobile insurance policies. Because of this statute, Maryland Auto is bound by the commission structure that no other insurer in the state is required to maintain. This existing commission framework does not reflect the many changes that have occurred in the insurance marketplace over the past 30 years. SB 637 repeals the statutory 10% minimum commission requirement while preserving the existing 15% maximum. It is important to note that this legislation does not eliminate commissions, does not alter the relationship between Maryland Auto and its producers, and does not mandate any specific commission rate. It simply removes the statutory constraint that limits Maryland Auto's discretion in managing its operating expense while retaining the ability to determine appropriate commission rates within the existing 15% cap. Responsible expense management supports the fund's long-term financial stability and strengthens its ability to continue fulfilling its legislative mandate. This is not a dramatic policy shift. It is a measured statutory update that reflects modern insurance practices while preserving producer protections and maintaining appropriate safeguards. For these reasons, I respectfully request a favorable report on SB 637. Thank you.
Thank you, Senator. Who'd like to go next?
Thank you, Madam Chair. Al Redmer, Maryland Auto. With me is Joe Danahy, our Associate General Counsel, and Devon Brown, our Government Relations Manager. First, thanks to Senator Jackson for introducing the bill. You have my written testimony, so this is not a complicated issue. This bill is designed to give us the same flexibility that every other insurance carrier in the state has. With my time, I'd like to address a letter of opposition you received from the independent agents of Maryland. While I have not seen the letter, I am told that they oppose it out of concern that we would just completely eliminate commissions completely, just go to a 0% percentage, and that's simply not the case. I spent more than 30 years as an independent agent myself. I own multiple insurance agencies over those years, and we have no intention of changing our distribution method. We will continue, as always, to use independent agents to bring their clients to us. So again, I will also point out that about 2 weeks ago, we had a producer town hall virtually. And during that producer town hall, we introduced this legislation to them to give them a heads up. And at that time, I made the commitment to them that, as always, in our relationship with them, we will continue to be proactive and transparent and collaborative and work with them before we make any changes at all. And with that, Madam Chair, we're happy to answer any questions.
Mr. Redmer, suppose we put a minimum in, so you have a minimum and a maximum, not, not less than 5% and not more than 15 or something, instead of just saying, instead of just taking out not less than 10%.
Certainly, if you want to do that, that's fine. I mean,
Okay.
there's a minimum today, and that's 10%.
Right.
So we're just looking to remove, and well, why don't we remove the ceiling too? And that's, that's.
Okay, I
that's-
appreciate it.
Yeah, but in any event, if you want to go to some other number, that's fine. We're just looking for the flexibility to do what every other carrier does.
Okay, I understand. Some people just don't trust what's not in writing. So,
I understand,
thank you. The rest of your panel going to speak, or are they here for questions?
just for questions.
Okay, any other questions for Mr. Redmer? Nope. Well, thank you very much.
All right,
Simple
thank you.
bill, thank you. Watson.
Good afternoon, Madam Chair, Vice Chair, and colleagues. I was watching some of the earlier testimony when Senator Kramer was up here, and there was a lot of love in this room. I hope the love is still around. For the record, I'm Senator Ron Watson, representing the 23rd Legislative District, here to respectfully request a favorable report on Senate Bill 623, known as the Maryland Premium Cigar Lounge Act of 2026. Last year, I introduced this bill, which resulted in a moratorium on the issuance of new liquor licenses to cigar lounges and instituted a work group. Why did we take that approach? Because as we looked into existing cigar lounges, several things became apparent. The most important of which was that there was no clear statewide standard for the safe and consistent operation of these entities. In addition, inequities existed across the state, as some jurisdictions had them and others did not. So before I start, let me thank the work group members, Senator Lamb, Senator Carl Jackson, and Delegate Stephen Arentz, as well as Jeff Kelly from the Alcohol, Tobacco, and Cannabis Commission, Finney Helmuth representing the cigar retailers, and Nilesh Kalyanaraman from the Maryland Department of Health. Maryland already has tobacconists and cigar lounges, but we don't have a clear, consistent standard when alcohol is involved. Senate Bill 623 creates a defined premium cigar lounge license with guardrails, ventilation plans, clear signage, employee acknowledgements, limits on where it can be located, and a maximum number that may be authorized in a county, and hours upon which alcohol may be sold. So adults can enjoy a legal product responsibly in a controlled environment while Maryland stops sending business, jobs, and tax dollars across the border. The work group also found that while some of the existing cigar lounges in the state held a license to sell liquor, others operated on a BYOB premise. In other words, outside liquor is allowed to be brought in and consumed on-prem. This bill removes that ambiguity by requiring a tobacconist to choose one or the other, but not both, in the operation of their business. Hang on. I have so many papers here. All right. So for the sake of time, the work group did a deep dive. And we actually, in this bill, have incorporated all the recommendations from the work group. The limitation on the number that can be allocated is going to be 1 per 150,000 residents. So that equates to 7 for Montgomery County, 6 for Prince George's County, 17 jurisdictions, I believe, have 2, and the remaining have 1, based on population numbers. I'm going to turn it over to my panelists here to go into a few more of the details that the work group came up with. Thank you.
Good afternoon, Madam Chair, members of the committee. Matt Boley here on behalf of the Premium Cigar Retailers of Maryland in support of this legislation. The association is approximately 35 brick-and-mortar mom-and-pop premium cigar retailers throughout Maryland. We are thankful to all the committee members who worked on this issue, the Department of Health, ATCC, and all the stakeholders who met in the interim to produce the work group report that I submitted in our testimony. We support the work group's report. We have submitted a reprint to this committee that further conforms the legislation to the report's findings. Broadly, this legislation provides certainty and safeguards that do not exist today for alcohol sales by cigar retailers. It provides a limited expansion. As referenced, only one licensee per 150,000 people may be issued by the local liquor boards. This bill holds harmless the tobacconists who went to their local liquor boards and received a local liquor license. It gives them 2 years to come into compliance with the new guardrails. It is a limited expansion that your constituents want and will help keep these dollars in Maryland, as premium cigar lounges are permitted in some form by our neighboring states. Notably, in 2023, Connecticut and North Dakota authorized cigar lounges, and Louisville followed suit in 2025. Overall, 28 states and D.C. have passed clean indoor air laws, and 25 of those 28 states have exemptions for cigar lounges. Last, Madam Chair, I am sure that today and over the next few weeks, you will hear some impassioned testimony on this matter, maybe even some feedback from our members that differs from what you hear today. I appreciate the passion of all the stakeholders and encourage the committee to consider their views and make the best choice on the facts. As always, we look forward to working with the committee and other stakeholders over the next few weeks. With that, I'd like to turn it over to two of our members, urge a favorable report, and thank Senator Watson for introducing the bill.
All right, 1 second. 1 sec, Madam Chair. I did find the remaining of my comments. This bill creates a Class C PCL, Premium Cigar Lounge alcohol beverage license tied to tobacconists. As stated before, it sets the limit on issuance and requires annual compliance reporting. The limits are 1 license per 150,000 residents for a county, Montgomery County up to 7, Prince George's up to 6, Baltimore County up to 5, Anne Arundel up to 4, and Frederick and Howard counties up to 2 each. The remaining counties are operated 1 each. Existing cigar lounges that currently sell alcohol are a part of this count. Those cigar lounges with a license to sell alcohol may be sold on-prem consumption Monday through Sunday, 10 a.m. to 1 a.m. the following day. Currently, neighboring markets capture cigar lounge spending from Marylanders, and Maryland should capture it too, under clear health and safety rules. Senate Bill 623 doesn't pretend smoke is harmless. It manages exposure and makes it explicit. Requires the applicant to include a building plan showing sufficient air filtration and exhaust. It requires conspicuous signage that smoking is allowed. The license applications have to include the details. Specification for the air handling system requires each employee to again, that acknowledgement, and ensures that there is a placard on the outside stating that smoke is consumed inside. Finally, it keeps venues primary tobacco-related business, not a nightclub, not a tavern, but a tobacco retail business requiring average daily receipts from premium sales of cigars and pipe tobacco and cigar-related accessories must be at least 70% of the total daily receipts. This will be enforced by the Alcohol, Tobacco, and Cannabis Commission. Other products sold may not constitute more than 30% of the retail tobacco business's gross annual income, and the annual license fee is $100. So in closing, this is a modernization bill. It recognizes reality, premium cigar lounges exist, and replaces ambiguity with enforceable standards, location limits, ventilation plans, visible warnings, employee acknowledgement, revenue ratio rules, and ensure it is a cigar lounge, not a bar, and not a tavern. We can protect public health, respect adult choice, and keep Maryland competitive in this region. Thank you, Madam Chair.
Good afternoon. My name is Feeny Helmuth. I'm the president of the Premium Cigar Retailers Association of Maryland since 2000, and I am the owner-operator of the Humidor Cigar Shop located in Cockeysville. Retail is challenging, especially for small family-owned businesses like mine. We must continually adapt to survive. This bill represents an important opportunity for shops like mine to evolve and remain competitive. For more than 28 years, we have offered our employees health insurance and retirement benefits. They are part of our family. They are all cigar enthusiasts, and they choose to work at our shop. The expanded operations would create additional earning opportunities for my team while improving the long-term stability of my family's business. This legislation is narrowly tailored. It ensures that premium cigar and pipe shops remain exactly that, not bars. The limited expansion allows adults across Maryland to enjoy a cigar lounge in a responsible setting. No one under the age of 21 is permitted in our shop. We card every single person who walks through our doors, and the adults that enter understand they are choosing to enter a smoky environment. The bill also protects businesses by preserving the ability to continue operating under the BYO model at the state level. Not every retailer seeks this liquor license. Many prefer to continue business as usual, and this legislation ensures no one is harmed in the process. The bill represents a meaningful lifeline for small businesses like mine, while also generating additional revenue for the state. I respectfully urge the committee to support this legislation and sincerely thank Senator Watson for introducing it.
Good afternoon, Madam Chair, members of the committee. My name is Raj Singh, and my wife and I proudly own the Tinderbox in Waldorf, Maryland, located in Charles County. We purchased the business in 2013 from the previous owner, primarily because then and now it is one of the very few cigar lounges in the state of Maryland that holds a liquor license. For the past 13 years, we have served a mature, professional clientele safely and responsibly. Our average customer is at least 45 years and older. These are working professionals, business owners, veterans, community members, and government employees who come to enjoy a premium cigar and drink in a controlled adult environment. We have never had any issues, and we intend to keep it that way. It is also important to note that the vast majority of individuals who work at our establishment are cigar smokers themselves. They understand the culture, the product, and the responsibility that comes with working in a premium cigar lounge. This is not an environment attracting minors or casual passersby. It's a very niche adult business serving an adult demographic with disposable income. Our patrons are not seeking noise or trouble. They are seeking refined, relaxed environments, and basically an extension of your living room is what we've provided. Through the moratorium and work group process, we now have a path forward with our bill. What I'm respectfully asking is for protection of my existing license also to be counted towards the cap, one license per 150,000 residents. We're not asking for expansion without limits. We're not looking for explosive growth. We're asking for fairness and certainty for our business that have already invested millions of dollars, created jobs, paid taxes, and operated responsibly over a decade. With increasing competition from DC, we simply want the ability to compete on equal footing while continuing to enrich Maryland's communities in a safe and controlled environment. We followed the rules, we built responsibly, we operate responsibly. All we're asking is that the state protect those who have already proven they can do this the right way, like us. Thank you for your time and consideration and a favorable vote for this bill.
Senator Lamb?
Thank you, Madam Chair. Thank you to the panel. I was glad to be able to participate in this over the interim. I know there have been a lot of conversations that have taken place in the meantime. So, I know there were amendments that were sent over to my office earlier. Did have a chance now to look at them, and had a question about the amendments. The amendment that we had received said, in reference to child and health care facilities, that that the facility, if they're sharing a wall with, there are provisions that would apply to it, versus like in the report, and I know we were trying to adhere to the report and whatnot, it says adjacent. So, is there some possibility of kind of ironing out that language just to be able to kind of reflect more closely the report, or maybe what was the intention behind that?
Yes, absolutely. I think that's, when we had the House hearing on this bill 2 days ago, that was also a matter of great discussion and one that we're certainly willing to work with this committee on. And I think based on some of the testimony we heard on Monday and probably some of the testimony you'll hear after this group is up here, I would think that shares a wall probably goes further in achieving sort of the separation of facility from a premium cigar lounge to whether it's a health facility, childcare facility, because then there's that physical connection, as opposed to adjacent. I think is a bit broader, or it could be the property line that's adjacent I mean, right now it could be, if we used adjacent, it could be a freestanding building and the property line could be adjacent. There's no shared wall there. There's totally separate ventilation. So that's why I think shared wall is probably a bit more precise and may be the better solution, but certainly willing to work with you and this committee on ironing out that definition.
Okay. The legislation is also, kind of as drafted, is bypassing any delegation enacted laws that are in place that regulate local bars, liquor stores, restaurants by delegating these licenses to be issued directly by local liquor boards, right? Would you be open to working through, amendments or considering amendments that would set a slightly different balance to ensure kind of fairness between the new licensees and the local licensees that have already worked through with their delegations to set up laws that function within their counties on this?
Yes. Yeah, and to clarify on that, in the reprint, I think we do a probably closer job to getting there in terms of it's May. This is going through the local liquor boards is the process. You may hear from the Licensed Beverage Association after this. I know they're looking at offering an amendment that would further clarify and strengthen that we have to go through the local liquor boards process. I haven't seen any language yet, but certainly willing to work with them and, of course, this committee on that matter.
All right. And you're probably familiar with the fact that the laws that provide for licenses that supersede or jump over delegation enacted laws are those that are there for manufacturers with tasting rooms and also for farms, which are very different and have different kind of state level implications than kind of what we're talking about here, which is just sole retail facilities and locations, right?
Yeah, again, very much looking forward to working out that language with you and the committee.
Okay. I think that's all I had for now.
Thank you, Senator. Senator Washington, are you ready? Or you want me to? Okay. I didn't know if you were having another conversation. Oh, I'm sorry, Senator Gao.
That's right. Thank you.
You do look alike.
Yeah, I can see that. Thank you very much, Madam Chair. Matt, so just so I understand what you're trying to accomplish here, to kind of follow up too on Senator Lamb's concerns, as far as the implementation in the county, when you're saying one licensee per 150,000 people per county, I mean, if a county wanted to reduce that amount, they could, or also if you're talking about concerns where, they're all grouped together, we could still try to impose like that. And I'm thinking kind of in the lines with similar discussions we have surrounding like dispensaries or something. We could, but this is not saying that there's like a guarantee, like you have to have, but we could lower it if you wanted to, right?
I'll say I see no guarantee in this language that there would have to be 4 new facilities in Anne Arundel County or 8 new in Prince George's, whatever the population. In the reprint, it is May for the local liquor board, so they certainly would have the discretion to say, yes, we are going to issue that license within the parameters set forth in this bill. But I would imagine they could also say no. There's always a hearing that's required for a liquor license, and this would go through that process. So there'd be public input and opportunity as well, beyond this process as to whether a liquor license is going to be awarded or not.
Okay, and then the existing, I mean, we've had a lot of discussions about the existing stores right now that, I mean, I think we had some concerns whether they should have been, allowed to sell alcohol, whether they should have been allowed to have a liquor license. So those that are right now, are they going to get converted to this license? Is that what the intention is, right?
Yes.
So that whatever the cap would be, it would fall into that.
Yes.
So I'm curious then, like, let's say Anne Arundel County, how many more then could we possibly, how many are existing and how many more could we potentially see by this?
So my understanding is there's 13 statewide, that would be available for this conversion. I believe that there are 2 in Anne Arundel, and what's Anne Arundel's population,
About a half, yeah,
630,000 or
roughly.
something like that. So 2 more perhaps. My math is always a little fuzzy and probably shouldn't be trusted, but maybe 2 more.
Okay. Okay. And then where it says permits BYO who do not hold a liquor license, I mean, are there any limits on that? Could anybody, be able to have BYO at their store?
I think, what we have now, or what we have here, is sort of an opportunity in that we don't have any statewide consistency as it comes to BYO. I think we have an opportunity here to create statewide consistency. And sort of the baseline is now, we're going to have an employee who's, trained on alcohol awareness program, Serve Safe, whatever it may be. Hours, other parameters. I think we have the opportunity here to gain, certainty, consistency, and clarity throughout the state where it doesn't exist currently.
Okay. Not sure. Okay. Well, at any event, I think we'll have more opportunity to discuss. So thank you. Thank you, Madam Chair.
Senator Jackson.
Yes, thanks, Madam Chair. So I see that the local liquor board does have a role in this. So does that mean that whoever gets these licenses, they would follow like the same local licensing hearings and things like that? Okay.
Yes.
Thank you. Yep. Thank you, Madam Chair.
I have a few questions if I can. Existing businesses that maybe do have an adjoining wall, are there any of those that have, they're existing now serving liquor, but they share a wall?
So in terms of all of our statewide tobacconists, I don't know with certainty. I think I've heard that there at least may be a couple. And I do think there should be some consideration and clarification as to how that would be administrated.
I think so too. If we're going to grandfather them, I think we need to say it.
Yep.
So if you'll check on that for me. And the ventilation system, does this mean that whether they're existing or new, that they're going to have the ventilation system?
Correct. Yes.
Okay. Because that could be expensive for an existing business. So does this mean that there can be an unlimited number of premium cigar stores, but a limit to the ones that serve alcohol? Is that?
So currently there isn't a limit on how many premium cigar retailers there could be in the state, other than, there's the limit that this is a very small sort of niche market. I mean, certainly the business demand or the customer demand is the current limitation on it, as it is for any other tobacco
So the
retailer.
limitation is only on the ones that serve alcohol?
That sell, correct, sell alcohol.
Sell alcohol. What kind of alcohol? What do they serve? Is it?
Raj, you might be.
Madam Chair, we sell full beer, wine, and liquor.
So you're a full.
We're a full bar.
Full bar.
Now, it's beer, wine, liquor, but it still will be subject to the 70-30 ratio, that 70% of the revenue has to come from premium cigars, pipe tobacco, and related accessories, where the other 30 could be, alcohol or whatever else.
Do you also serve food?
No, we don't serve any food.
Does the bill allow for the service of food?
The bill is silent on food.
Okay. Thank you for that. I see in your amendments, you have the license fee goes from 100 to 500.
That's actually had a conversation with Senator Lamb and some of the other health advocates. If we think 500 is a reasonable number, that's fine. Glad to discuss that with this committee as well as to what the most appropriate number may be.
Does the amended bill have ATCC doing the inspection and enforcement, or is it the local liquor boards?
My understanding, and I would certainly encourage a check with the ATCC, my understanding is both would have overlapping jurisdiction.
Okay, because there's an issue too with audits. If we're going to say a liquor store, a cigar store can only serve 30% liquor, somebody's got to audit that. And that's not what was happening in Anne Arundel. They didn't have any idea how much liquor was being sold, so. I think that was it. Okay, that's all my questions. Any other questions? Senator Reedy.
A lot of my questions have been answered. I just want to say that I do love that we're trying to work on this issue. So you said there's still love in the room, but I think if we are able to find a pathway here, I think it would be a positive. I felt like there's a little bit of hypocrisy in how we look at alcohol and cigar shops. So I know that we have entities in the state that have outdoor patios, but it's not really much of a patio. It's more of a room that has maybe some wide slats. So, I mean, I think it would be good to find a path here. I know we got to thread the needle, but I assume you all are really willing to work with advocates to try to get something done, even if it's a little less than what you're shooting for, correct?
Of course.
All right, thank you.
Are you finished? Thank you. A little history here. This actually started 2 years ago, Senator. You had a 2-year work group. It might have only seemed like a year, more likely felt like 3 years. But it's been an issue because in 2018, I think, maybe 2019, we passed the Clean Indoor Air Act. And this is totally in opposition to the Clean Indoor Air Act. The whole thing about that was that there wouldn't be alcohol and smoking in the same location. So happy to work on this, but it is an exception. And I don't know what the health department's involvement will or will not be. So I think we just need to be careful that it's for a very limited scope, for a very limited business. I've already had places call my liquor board and try to have taverns add premium cigars. So you see what's going to happen?
Yeah.
So it's really going to have to be carefully enforced. Senator Washington, and then we'll come back to Senator Lamb.
I think that changes my question a little bit then. I was going to ask about just the ability for because our liquor boards go by the rules and laws that happen here in the state, and sometimes it's not really direct, and sometimes the question is, do we allow them to promulgate regulations under this bill so they're able to implement and enforce the law?
Yes, the local liquor board should be able to, effectively work and implement to enforce this, correct?
But does it explicitly state that they're able to promulgate rules and regulations on top of what we've said that if this bill passes?
I don't believe that language is in there this time, and certainly willing to work with this committee on such language.
I mean, the question is, I wondered how, there's some establishments that should be awarded this, and there's some establishments that don't. And I wonder if they have the ability as a liquor board to deny any or put in abeyance any of these licensees that apply, that fall under the rule.
Correct, yeah. They absolutely would have the ability to deny a license. I think your question was, could they do something in advance for certain entities? I don't know if they could do that, but I'm sure we could get the answer for that.
Yeah, I would like to answer if they could deny an entity if they had
Some kind of
previous
track record,
encountered
yeah.
a track record of not being a good player or or having violations in the past. I would like for them to be able to have that ability to have a denial if they need to, for whatever reason they might be. That's why I think it's important for them to be able to promulgate regulations on top of what the law states too, so they can implement this at a successful rate that's applicable to their county. Does that make sense?
I think that's very reasonable.
Thank you.
Thank you, Senator. Senator Lamb?
Yeah, thank you, Madam Chair. Just to follow up on Senator Jackson's point, I think, he did point out the fact that these licenses would be coming from the local liquor board in that jurisdiction. And I think in the responses, it seemed to suggest that these institutions have to follow the local county-specific laws, but that's not actually clear from this bill, the way it's drafted.
We can certainly go further to clarify that, and as said to Senator Jackson and others, willing to work to codify that.
And so the bill sets the cap on the total number. Of course, that can be reduced down by the locals, but the bill is specific on the hours of operation in which alcohol can be served in one of these environments. And that cannot be, we could make it worse with the county if they wanted to, but that's also kind of a cap.
Right. I mean, I think it would be helpful to have that clarified, I think, rather than presuming that that's the case, because most, non-manufacturer retail locations do need to follow the laws that are passed by the relevant county jurisdictions, right? And so,
That's correct.
so I think that's kind of important to keep in mind. You know, the chair had mentioned earlier as well that, you know, this is allowing for beer, wine, and liquor in a way that this is not a privilege that we have given to other businesses, right? This is really exceptional in this way. So just want to be very cautious in how we, you know, approach that and address any of these loose hanging threads that I think should be clarified as part of that process.
I think further clarity, guardrails, make sense again, and glad to effectuate that with this committee.
And then last question here, I guess, if you could clarify, does the bill exclude cigarette smoking or vaping on premises? Because I think the Department of Health seems to believe that it does not, or it believes that it does.
Yeah, I believe it's in there and that it's premium cigar and pipe tobacco sold by the license holder. However, at least as it comes to cigarettes and vaping, be glad to further strengthen and clarify that those products will not be smoked in the lounge.
Okay. Okay. Thank you. Thank you, Madam Chair.
Okay, I don't see any other questions. That ends this panel.
Thank you.
Our next panel is, or our next person is Steve Wise, favorable with amendment. Thank you all.
Good afternoon, Madam Chair, members of the committee. Steve Wise on behalf of the Maryland State Licensed Beverage Association. You've already kind of discussed the issue that brings us here, which is the bill certainly implies, based on where it would be inserted into the current law, that all of the normal provisions that govern the issuance of licenses, the renewals, and so forth would apply. But we'd like to see an amendment that makes that clear. I have not drafted that because I know that there was a reprint coming, which Mr. Boley sent to me, but I haven't had a chance to review yet. But now that we have that, we will do it. And if I might also respond to Senator Washington's question real quick about the regulations. While you may want to put that in the bill, there is an overall provision in the alcoholic beverage law already that gives the board's ability to develop regulations really on anything that is given to them in terms of authority. So with that, I'm happy to take any questions.
That was very short. Do you have any questions for Mr. Wise? Senator Guile.
Mr. Wise, you're the people that you represent, licensed beverage holders. Are they going to come back later and start asking us to be able to sell tobacco inside of their establishments
Well, Senator,
and be able to smoke indoors?
let me say this. I'm focused on getting through the next 45 days.
Okay.
I have no idea what they will ask for in the
Okay.
future. Maybe there's some interested. The chair certainly said maybe some are that in Anne Arundel, but no, we're just trying to get through this. And I will say we've opposed the bill in the past. We thought Senator Watson's work group put the proper sort of guardrails and constraints around it. Maybe there's some others that need to be added, but that's why we're here favorable with amendments this year rather than opposed.
Okay. All right. Thank you. Thank you, Madam Chair.
See, if you bring back a bill often enough, something starts to happen.
You wear the opposition down.
Yeah. Thank you, Steve. I don't
Thank
see
you.
any other questions for you. We'll look forward to your amendment.
That'll take a little while longer.
Okay, we have 3 unfavorables at the table: Eric Galley, Charles Debnam, and Lance Kilpatrick. And then we'll have 2 more unfavorables virtually after this. Thank you.
Good afternoon. My name is Eric Galley, and I'm here today representing the American Heart Association. I've worked on the Clean Indoor Air Act every year since 2004, including 2007 when we finally passed the legislation. And I know Mac Middleton was here, and he could vouch for the fact that I've been here. I don't know if he's still here. And before I get started, I just want to thank you, Madam Chair, for all of the great work that you have done, first on ENT and now as Chair of the Finance Committee. It's been a great pleasure working with you directly on a lot of issues, and I'm going to miss you dearly. So I just wanted to say that before we.
You'll have 9 more months. You're going to have to put up with me till December 31st.
I think we're all just kind of recovering. We got the news late last night, and we're all just kind of recovering. And I also wrote this in a tense that has changed a little bit. But I wanted to talk a little bit about what has gone on elsewhere on campus the rest of today. Earlier today, hundreds of people packed into the joint hearing room to figure out how we're going to deal with the ever-increasing cost of Medicaid and the reduction of assistance from the federal government. Over in Budget and Tax, there was a bill dealing with expected increases in hospital intake and the fear that added pressure could lead to medical errors. That bill's a very good sponsor, and I think it's going to pass. And right here, every day you deal with the ballooning cost of private health insurance and prescription drugs that combat high blood pressure, heart disease, asthma, and the various cancers that are caused by secondhand smoke. And I know I'm not supposed to talk about it, but everyone knows that there is a chance that next year you may have to come back and raise taxes, partially to cover the Medicaid increases. Not a good time to make life even more expensive for Marylanders. And now, right in front of us, right here, we have a bill that includes the following sentence. A local licensing board shall require each employee of a licensed establishment to sign an acknowledgement that the employee will be subjected to secondhand smoke. Seems like a very bad time for us to be taking a major step backward and compounding the huge problems that we already face. For these reasons, the American Heart Association urges you to vote unfavorable on this legislation. Thank you for your time and attention.
Sure. Thank you. Good afternoon, Madam Chair, Vice Chair, and members of the Finance Committee. My name is Charles Debnam, and I'm testifying today on behalf of the African American Tobacco Control Leadership Council, which is in strong opposition to Senate Bill 623, the Maryland Premium Cigar Lounge Act of 2026. AATCLC works to eliminate the unequal burden of tobacco-related disease in Black communities and to advance policies that protect all people from harms of commercial tobacco. For that perspective, SB 623 represents a significant step backwards for public health, worker safety, and health equity. First, this legislation weakens Maryland's clean indoor air protections by creating new exemptions that allow indoor cigar smoking in designated lounge settings. These protections exist for a reason: to safeguard workers and the public from secondhand smoke exposure and third-hand exposure, which is known to cause serious cardiovascular and respiratory disease. Employees in cigar lounges should not be required to breathe toxic smoke as a condition of employment. No business model should depend on exposing workers to known health hazards. Second, SB 623 expands the normalizes environments that promote combustible tobacco use. Premium cigar lounges are designed for consumption. They encourage and prolong smoking, social reinforcement of tobacco use, and increase exposure to harm emissions. At a time when Maryland invests in tobacco prevention and cessation, creating new venues centered in smoking scenes, conflicting and harmful public health messages. I'm trying to look at this clock here. So I'll end with this, though. Maryland has been a leader in protecting residents from secondhand smoke and advancing health equity. This bill moves in opposite direction. Public health policy should reduce exposure to harmful products and do not expand the places where they are consumed. Thank you.
Madam Chair, Mr. Vice Chair, members of the committee. For the record, my name is Lance Kilpatrick, and I'm the Government Relations Director for the American Cancer Society Cancer Action Network. This legislation is framed as economic development and entrepreneurship, but economic growth should not come at the expense of public health. Nearly 2 decades ago, Maryland enacted the Clean Indoor Air Act to remove smoking from indoor workplaces and public spaces. The intent was clear. No one should have to breathe secondhand smoke to earn a paycheck. Senate Bill 623 moves us backwards.
This bill authorizes on-premises alcohol consumption in venues where smoking is permitted, and it requires each employee to sign an acknowledgement that they will be subjected to secondhand smoke. That requirement is deeply troubling. Maryland's workplace safety laws have never been built on the idea that a worker can simply consent to a known carcinogen. We do not ask employees to sign acknowledgements agreeing to breathe asbestos, benzene, or other toxic substances. We set standards that prevent the exposure in the first place. Secondhand smoke is a known carcinogen. Ventilation systems and air filtration do not eliminate the risk. A signed form does not change that science. Supporters argue that employees choose to work in these establishments. But public health protections are not supposed to depend on bargaining power or limited job options. The Clean Indoor Air Act recognizes that workers deserve a baseline of protection regardless of where they work. Senate Bill 623 creates a separate class of workers who are expected to accept preventable health risks as a condition of employment. The bill says that a cigar bar can't be next to a licensed healthcare or childcare facility, but smoke does not respect walls, and neighboring businesses, regardless of what they do, and their employees have no such protections or acknowledgments to sign. The Act's purpose was to create smoke-free indoor environments broadly, not to carve out new exemptions tied to alcohol service. For these reasons, ACSCAN respectfully urges an unfavorable report on Senate Bill 623. Thank you.
Thank you, Lance. And I do understand how important this is to the American Cancer Society. I also know that we unfortunately had a number of counties issue licenses. And I think it's framed as economic development because we don't want to put anyone out of business, certainly put some guardrails and restrictions on how they operate. So I understand your concern. I just don't think there's much we can do based on what the counties have done to us. So, but thank you for your testimony. Do I have any questions for this panel? Oh, Senator Jackson.
Thanks, Madam Chair. So this bill deals with being able to have alcohol in smoke shops, but it seems like, or cigar shops, it seems like you're focusing on the premise of having a cigar shop in general. Like, you're not speaking on what this bill is about.
Well, I would say that the original bill, the law as we have it now, the intent, and I wish Mac were here to speak to this, the original intent was that there would be tobacco shops and selling cigars, and that there should be a small exemption for when a person is in a tobacco shop and they're looking at a cigar, to buy a cigar, that they be allowed to puff it for 3 or 4 minutes and test it before they
But
purchase
that's not
it.
what this bill is about.
Right.
Right.
That was the original.
Right. So
This
why are
bill
we
is,
talk-
this,
why-
this
sounds
bill
like
is
we're trying to
creating.
rehash the very existence of a cigar shop.
Right, well, we're saying the issue with this is the public health aspect of it, that if we have these, that we will be creating a lot more.
So you don't have no comment on alcohol being in smoke shops? You have
Well,
a comment on that?
We like the way it was done right now, which was that it said that if you had, that there would be, you wouldn't have the two things. You wouldn't have liquor and you wouldn't have tobacco together.
Okay.
Senator, may I build on Eric's comments? The concept when this was originally signed, the Clean Indoor Air Act, was that people weren't going to be lingering in that environment for an hour or 2 hours on end, right? So what this does, it creates a perverse incentive for individuals to linger into that environment.
Have you been in the cigar shop?
Yes, I have, sir.
Okay, so they're there anyway. It's a social.
Right. But the difference
kind of
is
thing.
that previous to this concept, right? Most people go in, they sample, they look around, they leave. They're not staying for an hour, 2 hours on end, for the most part.
I'm not
This
sure
adds
which-
an added incentive to stay and
But
hang
they're
around.
already there, and it's bring your own drink. So,
well,
so it's already happening.
Would you
Go ahead.
agree?
Go ahead.
Yeah, we didn't love to bring your own drinks, but they were, at that point, to this point, the people who are doing the bring your own drinks are obeying the law as it is right now. So we didn't fight for a further cracking down on it.
Thank you. Thank you, Madam Chair.
You're welcome. I don't see any other questions. Thank you to this panel.
Thank you.
Thank you, Madam
Okay,
Chair.
I think we have 2 virtuals, and they're here, okay. Very good. So let's start with Paul Billings. Paul, you
Thank
want to
you.
unmute and go ahead?
Yep. Good afternoon, Madam Chair and members of the committee. My name is Paul Billings. I live in Silver Spring in District 19. I'm proud to have Senator Ben Cramer represent me. I'm a volunteer with the American Lung Association of Maryland. I'm here in strong opposition to Senate Bill 623, which would allow for cigar bars in Maryland exposing more people to secondhand smoke. The bill would undermine Maryland's Strong and Clean Indoor Air Act, a law I strongly advocated for in 2007. The Clean Indoor Air Act is a public health success. The public strongly and overwhelmingly supports smoke-free environments. Secondhand smoke kills, even secondhand smoke from so-called premium cigars. It causes coronary heart disease, stroke, and lung cancer in adults who do not smoke or use tobacco products. Decades of research has demonstrated there's no safe level of exposure to toxic secondhand smoke. The bill alludes to the danger with a vague requirement for workers who are exposed to secondhand smoke for thousands of hours each year to acknowledge they are being exposed. I ask, what is the purpose of this provision? Is it to shield the business owner from culpability and liability for cancer and heart attacks? Ventilation cannot remove toxins and heavy metals, mercury, arsenic, lead, cadmium, to protect people, including workers in those establishments, and in the neighboring and adjacent spaces. Let me repeat this. The toxic and lethal smoke will migrate into adjoining workspaces. No one should have to breathe secondhand smoke in their workplace. Customers and workers in an adjacent restaurant, bridal shop, bookstore, or other business should not be forced to breathe this toxic secondhand smoke. Expanding this loophole to allow cigar bars to operate undermines our successful and popular clean air statute and threatens the health of all workers. I ask the committee continue its commitment to protecting the health of Marylanders and report unfavorable on Senate Bill 623. Thank you.
Thank you. Kristen?
Madam Chair, members of the committee, good afternoon. I'm Kristen Jemison. I'm the Regional Advocacy Director from the Mid-Atlantic for the Campaign for Tobacco-Free Kids. I echo all my public health colleagues today in strongly opposing this bill and hope that Maryland will continue to protect its strong nationally recognized smoke-free laws. Maryland's Clean Indoor Air Act helps send a clear message that tobacco use does not belong in indoor public spaces. The clarity of that message matters. It reduces visibility, limits normalization, and reinforces that tobacco use carries real health risks. When the state creates new exemptions, especially exemptions that allow indoor smoking along with alcohol consumption, it sends the opposite message to our youth. It signals to them that this form of use is acceptable, sophisticated, and potentially aspirational. Young people can and are influenced by what they see adults doing, what they hear about from adults, and by the environments that their communities sanction. When tobacco use is carved out for special treatment, it weakens the broader prevention message that has helped reduce youth tobacco use over time in Maryland. And tobacco use does remain a leading cause of preventable death in the United States. Maryland has made meaningful progress in protecting young people from tobacco and nicotine addiction by maintaining consistent and clear standards. Creating new exemptions for indoor cigar smoking risks undermining that progress and sends a mixed message to our youth. For those reasons, we respectfully urge an unfavorable report on Senate Bill 623.
Thank you, Kristen. I don't see any questions for this panel. Thank you for your comments. That ends the hearing on Senate Bill 623. Mounts, you ready? Senate Bill 703.
Thank you, Madam Chair. And can I bring a witness to counsel to the table to answer questions? Yeah. Thank you, Madam Chair. Mr. Vice Chair, colleagues, it's a great honor to present Senate Bill 703. This is a delegation bill from Caroline County on behalf of the Caroline County Senators. It just corrects an existing requirement in law dealing with the licensing of canines. And right now on the shore, Caroline County is required by code to have an onerous process by which they have to license canines. And this would take that onerous process off the county, still authorize the county to license canines, like other surrounding counties, and is also supported by the local Caroline County Humane Society. And with that, I'd urge a favorable report, and I appreciate, I'm happy to take any questions. Thank you.
Thank you. Steve?
You may be wondering why I'm here, but the answer is I represent the Caroline County Commissioners, and none of them were able to attend. So that is why I'm here. I think the senator did a great job outlining the bill, but I'm happy to answer any questions.
Thank you. You sure have an interesting portfolio.
And
Sort of like our
dogs,
committee, all over the
alcohol.
place. Do I have any question? Oh,
Healthcare.
Senator.
Yeah, thank you, Madam Chair. All right, either Senator or Steve, share with me what exactly does the bill do and why? Is this like, you know, in Montgomery County, since I think I was in high school, dogs had to be licensed in the county. You own a dog, you had to have an annual license for it, and you had to document that the dog has its rabies vaccination. What is this license that you're referring to, and what is the goal?
Okay, so this was discovered by the council for the county, and there's a very long statute, which is all in the bill. The current law requires the county every year to issue a new dog license to every dog with a new serial number, and it goes so far as to say that the general shape of the tag has to change each year. So it's extremely onerous.
Okay.
If you look at 7 other code counties, which include Carroll, Cecil, Dorchester, Frederick, Harford, Kent, and Somerset, they have the law that will remain if this bill passes, which simply gives them the authority to license dogs and adopt rules and regulations to do so.
And this relates strictly to individual ownership. It has nothing to do with breeding or multiple ownership. Does it have anything to do with that? Because I know we do have local jurisdictions that have licensing requirements with regard to breeding dogs. And if you have a certain number of breeding-aged female dogs, all to ensure that we don't have puppy mills in the state. So does this tie into any of that, or this is just simply is this dog registration
Correct.
For individual homeowners?
The latter. It is the dog registration and licensure for individual dog owners.
Okay, thank you.
I don't see,
Oh, boy.
Oh, boy. Thank you, Madam Chair. But just to recognize, Steve, what you mentioned, that because Caroline County is a code county, they have to come to the General Assembly and talk to everybody to help make decisions for them.
Correct.
Whereas my colleague from Montgomery County does not have to come to the General Assembly to make a lot of decisions. So, no, it doesn't make sense at all, to be honest. And that's the concern. So the reality is, if this legislation does have the authority and the approval and the support of the Caroline County Commissioners, this is truly a local bill. Thank you, Madam Chair.
thank you, Senator. All right, I don't see any other questions on this bill. This ends the hearing on 703.
Thank you.
Next, we're going to have the delightful Senator Kramer, Senate Bill 740. It is the last bill of the day.
I'll try to roll, Madam Chair, and you'll be very happy with the outcome here.
I hope so.
Madam Chair, members of the committee, Ben Kramer here to introduce Senate Bill 740. And if you take a look at the panel up here, colleagues, we've got what were originally the proponents and the opponents sitting together in a very happy kumbaya moment. And that's all because, colleagues, as you well know, my middle name is Ben. Let's find that middle ground, Kramer, and have consensus. So real fast, let me explain the bill, colleagues. I appreciate testifying in support of this bill, which is legislation that sets a clear and reasonable standard governing the deactivation of transportation network operators, basically who you're seeing here. We've got Uber and Lyft represented, commonly known as transportation network operators, and our network operators, typically what we refer to as rideshare drivers. Transportation network operators do provide an essential service in Maryland. They connect residents to work, medical appointments, grocery stores, airports, and nightlife. They fill gaps in public transportation and enhance mobility across our state. Yet the individuals performing this work operate in a bit of a legal gray area. Rideshare drivers are classified as independent contractors, not employees. As such, they are not afforded the traditional workplace protections that accompany employment status. They do not have access to unemployment insurance if deactivated. They are not covered by many of the procedural safeguards that exist in employer-employee relationships, and they often have no meaningful avenue to challenge the loss of access to the very platform that provides their livelihood. This bill does not seek to reclassify drivers as employees. It does not mandate benefits or impose employment law frameworks. Rather, it establishes baseline procedural fairness, clear, transparent, and reasonable standards when a driver faces deactivation. For an independent contractor whose income depends almost entirely on access to a digital platform, sudden deactivation can have immediate and severe financial consequences. Mortgage payments, rent, car loans, and insurance obligations do not pause when access to the app is turned off. So, what does the bill do before you do as it has been amended? And colleagues, every one of you has at your desk, if you dig through your paperwork, and Tammy gave me the evil eye while I distributed this to your desks, but it is the bill as it now exists and as amended. And the bill before you as amended provides a clear notice of the specific reason for deactivation, an opportunity to respond or appeal, a fair and timely review process, written standards governing conduct that may lead to deactivation, immediate deactivation only in cases involving credible threats to public safety. This is not radical, and it reflects a fundamental principle of fairness and due process. Colleagues, I want to offer my thanks to Rob Garagiola and Uber and Lyft, as well as the operators who drive for these companies. We all worked very closely over the past several weeks to work out what I believe is a good, common sense bill that is before you and that we all have agreed to. And with that, Madam Chair, I will turn it over to our Kumbaya panel.
Madam Chair, members of the committee, Rob Garagiola with Compass on behalf of Uber. As a former member of this committee and in the spirit of what I heard earlier, I love Ben Cramer too.
There it is.
We worked, as he said, over the last several months on amendments. I think we need to kind of finalize a couple elements. I want to follow up with that, but I think we're essentially there on the amendments. We're happy to have worked with him as well as Delegate Fennell in the House and some of the operators to get to this position. I'll keep my testimony short and turn it over to Levita Gardner with Uber.
I will be equally as short. Thank you for the opportunity to testify before the committee
Thank you, Senator Kramer, for allowing us to work with you and your constituents on this. We agree we are in a good place with the bill as amended, and we urge a favorable report with amendments.
Good afternoon, Chair, Vice Chair, committee members. My name is Jeffrey Sweetland. Back in Father's Day weekend of 2023 on Uber, I was falsely accused of sexual harassment. It took Uber 1 month to tell me what I was accused of and 2 months to speak with their safety team member, only for that safety team member to ultimately choose to permanently deactivate me. Uber not only refused to listen to my side, but I couldn't even defend myself through the Greenlight Hub, Uber support phone line, or even the critical safety line. I struggled with and still am dealing with some PTSD from this incident. And when I couldn't get any help and Uber's refusal to even remotely listen to my side, there honestly was a part of me that wanted to commit suicide. I did not know this at the time that you had to fill something out, but I actually have actual phone records and Uber's own words where they acknowledge that customers do make false complaints. If you all would be willing to take a look at this, please. For the record, I had been with the company for over 8 years, 4.92 rating, and close to 14,000 trips. Looking back on it, it was a blessing in disguise because I would not have found an organization that was actually willing to stand up for drivers. I would not have found a very good friend who's also a driver. But this runs much deeper than what's before you. There's hundreds, if not thousands, of Marylanders who do not have a voice, who choose to use this app, whether full-time or part-time, and they do not have a voice when they get deactivated. Also, it needs to be mentioned that there was no police report, evidence, or proof that I ever did what I was falsely accused of, yet Uber chose to side with the customer. That's very disgraceful, I would say, for a company that has zero tolerance towards discrimination.
Hello, good afternoon, Mr. Chair, Madam Chair, Vice Chair, and members of this committee. My name is Francisco Flores. I am a disabled veteran. I drive for Uber full-time for almost 9 years now. I'm here to support this bill. I'm here because I was deactivated for about 4 days. It's nothing compared to my partner here. Uber said to me that someone complained about an argument that they had with me. Uber said that they couldn't tell me who, where, or when. I was thinking, how can a driver defend themselves against false accusations like that? If they don't know all the information. Because of my good record of 7 years, more than 10,000 rides, they activated me back. I was scared out of my mind because of this. This is my full-time job. Because of my disability, I can't do most of the jobs out there. So driving, and I love driving, and I thank Uber for having an app like this for us that can't do many jobs out there. There's been flyers out there where if a passenger complains, it said that they could get their money back. And that's where they were doing false accusations on anybody. But people don't know that when they do that, we lose our jobs until someone in another state is determined to activate you back or not permanently. These investigations have no proof sometimes or police reports. For those type of reasons, drivers tend to just say nothing at all to nobody, just confirm the passenger. And now they have videos, cameras for proof. And for this, I ask for y'all to vote in favor of this bill. Thank you very much.
Thank you. That's everybody, right?
Yes,
Any
ma'am.
questions for this panel? I don't see any questions. Thank you for working together. It's always good when we can collaborate. I have someone favorable with amendment, so I don't see any questions. Thank you.
I'm sorry, Madam Chair?
This panel's finished.
We're done.
I have someone favorable with amendment.
Oh, I got you. Okay, thank you.
Ronza Othman from the National Federation of the Blind, favorable with amendment. You okay? There we go. Thank you, Ronza. You're the only person on the panel.
Okay. Good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. I appreciate the opportunity to testify here on SB 740. I am the president of the National Federation of the Blind of Maryland, which is the state's oldest and largest organization of blind, low vision, and deafblind Marylanders. We are routinely subjected to discrimination by rideshare drivers and, as a result, by their companies due to having service animals, long white canes, and other mobility devices. We have, on multiple occasions, attempted to resolve that discrimination and proactively prevent it through everything from mediation efforts through litigation, which have resulted in findings of discrimination at the corporate level and by individuals, as well as through other means. Currently, the Department of Justice is investigating Uber in particular, related to continued rideshare denials based on discrimination for passengers with disabilities who use service animals and long white canes. This weekend alone, on Saturday, 6 individual members of our local Greater Baltimore chapter experienced rideshare denials because of their guide dogs or because of their long white canes. There is virtually no accountability. The only accountability that we have is that rideshare drivers are suspended and deactivated. They are suspended for one offense and deactivated for multiple offenses. We are sick and tired of having to waste our time and money, miss jobs, miss doctor's appointment, miss dialysis, get sick, because we are left behind by drivers who refuse to take us under the law which is required, the Americans with Disabilities Act. We are seeking an amendment to the legislation which would clarify that discrimination, as the amended language includes language saying discrimination is a valid reason, but that discrimination including rideshare denials due to the use of a service animal, long white cane, or other mobility device be explicitly stated in this bill. Currently, it is subjective when Uber or Lyft or other transportation network companies try to make a determination around these allegations, and we want it clearly understood by the drivers that this is an absolute line that they might not cross. For that reason, we request a favorable report conditional on this amendment. Thank you so much.
Thank you very much. Do I have any questions for this witness? I don't see any questions. Thank you very much. And we have one unfavorable, and it's Margaret. Thank you, Margaret.
Good afternoon, Chair Beidel and members of the committee. My name is Margaret Durkin, and I'm with TechNet, a tech trade association. I did sign up as unfavorable 2 days ago, and then I was alerted by my members that there were conversations around amendments. So I will echo what the first panel said about working together with the sponsor. My current concerns on the bill as drafted have been submitted, but as mentioned previously, I will follow the lead of my members, and they seem to be working with the sponsor. Thank you.
Margaret, that was a very nice testimony at the end of the day. It's nice to see you. Thank you. I don't see a
Likewise.
question for Margaret.
Thank you.
Thank you. Can I ask the Uber representative to come back to the table?
Absolutely.
Hi. Can you address for us the concerns that the representative from the blind talked about?
Absolutely. So as was mentioned, Uber has a zero tolerance policy for discrimination. Our drivers, which I believe they will attest to, know that this is an offense that is not accepted. Whenever it is reported to Uber, a full investigation is conducted, and we do take the process to remediate or deactivate in situations where discrimination has occurred.
Can you remind your drivers of how important this is for the community with disabilities? On a regular reminder.
So yes, we have in-app training for all of our drivers on accessibility, disability, how to work with the community. It is available in the app at all times, and they do receive reminders.
So again, if it happens, they pull up and they don't accept the person either because of the long cane or the dog. They just report it and they're deactivated, or?
If it's reported, it's investigated, and the process plays itself out as it's outlined, yes.
Thank you. Thank you
Absolutely.
for coming back to the table. Do I have any other questions? Thank you very much. That ends the hearings for today, and we'll see you all tomorrow at 1 o'clock.
Look at that.
Thank you.